So good evening. My name is Steve Davis. I'm the Director of the Division of Healthcare Facility Licensure and Certification of the Massachusetts Department of Public Health. With me this evening from the department is Judy Bernice, our Licensure Unit Manager, Walter Mackey, our Licensure Unit Coordinator, and Julie Crocker-Wilson, our Licensure Inspections Manager. If you do not wish to speak here in person tonight, you may submit your comments by email to, and I'll spell this out, hfllicenseaction@mass.gov. That's hfllicenseaction@mass.gov, or by fax to 617-753-8089. Again, that's 617-753-8089. On behalf of the department's commissioner, Margaret Cook, and our bureau director, Elizabeth Kelly, I want to thank you for taking the time this evening to participate in this hearing. The department is holding this hearing on Northeast Hospital Corporation's proposed closure of outpatient birth center services at Beverly Hospital. This evening's hearing provides members of the community with an opportunity to share comments or concerns on the proposed changes in a public forum. Please note, however, that we are not able to answer questions about the proposed changes during this hearing. Before we begin, I'd like to provide a brief overview of the steps that will follow this evening's hearing. The department will complete its review of the proposed changes based on the comments received this evening and those that are submitted in writing to the department. Based on a review of the evidence presented today, the current utilization of these services, the capacity of alternate sites to provide the service, and other relevant information available, the department will make a determination as to whether the services to be discontinued are necessary for preserving access and health status in the hospital's service area. The department will make its determination within 15 days of today's hearing. If the department finds that the services to be discontinued are necessary for preserving access and health status, the hospital must submit a plan for assuring access to the service within 15 calendar days of the department's finding. Based on our review of the plan, which the hospital submits, the department will either approve or provide the hospital with written comments within 10 days. If the department finds it necessary to make comments on the plan, the hospital must provide responses to those comments in writing within 10 days. We will begin this hearing with a brief presentation from the licensee. Following this presentation, we will provide an opportunity for local or elected officials from the community to comment, and then begin calling on those individuals who have requested to speak this evening. I now will ask Tom Sands, president of Beverly Hospital, to make a statement on the proposed changes. Following Mr. Sands, Kim Perryman, the chief nursing officer of Beverly Hospital, will make a statement also on the proposed changes.
Good evening to our community, our elected officials, and the leaders of this hearing from the Department of Public Health. I am Tom Sands, and I would like to thank you for allowing us to come and present to you this evening. Beverly Hospital is a full-service 221-bed community hospital providing high-quality, patient-centered care to residents on the North Shore in Cape Ann. We are proud to be an integral and valued part of this community, your community. Our skilled and compassionate caregivers and staff have always put patients at the center of everything we do. And their commitment has never been more apparent than it has been this past 2 years as we have supported and cared for our community during this pandemic. I'm here to share with you today further background on and context around the planned closure of a component of our obstetrics and gynecological services, the North Shore Birth Center, this fall. I also want to underscore and provide further details on our dedication to continuing to provide access to strong women's health services and offering choices in how they receive care. We know what a special and important place the birth center has been to our community over the years. The decision to close the birth center was not made lightly or easily. And we understand that this news is difficult for many. And I want to be very clear that this decision was in no way a reflection on the talented, caring, and compassionate team that staffs the birth center. They care deeply about the mission and our patients. I also want to clarify that the challenges facing the birth center are not patient volume, not reimbursement, nor community support. Rather, the driving factor behind the closure was the inability to find the right complement of qualified staff in a range of important roles necessary to run a high-quality, hospital-based birth center. Like healthcare organizations across the country, we have experienced the significant impacts of a national workforce shortage and resulting staffing issues. Staffing at the birth center has been difficult for years. And the absence of a consistent individual serving in two critical leadership roles of medical director and midwifery director has further hardened our efforts and hindered our efforts to recruit and retain skilled and experienced staff. State regulations require a certain number of employees with specific qualifications to staff a birth center in order to assure safe, high-quality care, and we have not been able to consistently meet the requirement at the birth center for many months now. As we were considering the long-term future, the immediate staffing issues grew even more acute. As a result, this past March, we had to pause accepting new patients at the birth center, and since January, all births have occurred at Beverly Hospital due to the staffing shortage of qualified nurse midwives at the birth center. Now that we have determined it is no longer possible to operate the birth center, our goal is to maintain staffing that is consistent with the hospital's licensure requirements through September 8th, with outpatient care continuing to take place at the birth center and births continuing at Beverly Hospital. Beverly Hospital will continue to be a welcoming resource to women who have chosen a midwife for their care. Several of our OBGYN practices employ midwives. We are proud of the more than 2,200 babies that come into the world each year at Beverly Hospital. In addition, we are thinking strategically about the both short and long-term investments in programming and facilities to continue to advance women's health at Beverly Hospital. I want to thank you for your time. I'm joined here today by our Chief Nursing Officer, Ms. Kim Perrin, and I'd like to ask her to talk a bit about our plans for the future. Kim?
Before Kim starts, if we could just please keep the comments to yourselves while people are speaking, that would be very helpful. Please respect the people who are speaking.
Thank you. Hi, everyone. My name is Kim Perrin. I'm the Chief Nursing Officer at Beverly and Addison Gilbert Hospitals. I want to reiterate how difficult this decision has been, although we know it's necessary as we continue to face significant staffing shortages. As Tom mentioned, staffing at the birth center has been a challenge for years, and I'd like to provide a few more specifics related to that. It's critical for patient safety and to ensure the highest quality patient care to have a sufficient number of certified nurse midwives on our staff. In the healthcare employment market with high turnover, some unique aspects of recruiting and onboarding newer nurse midwives have come into play. Sorry about that, I didn't realize I had my mask on. One significant factor is that it takes on average 11 to 14 months to onboard a new nurse midwife. Like the national shortage of experienced healthcare staff, we too are experiencing this shortage locally with our certified midwives at the birth center. Over time, this has impacted our ability to continue to effectively train and support new team members in order to successfully deliver the high quality and safe care that our community has come to know and to trust. I assure you that Beverly Hospital remains committed to providing comprehensive services to our community, including a range of women's health services and obstetrical and gynecological care with excellent health outcomes. We offer comprehensive services for a wide range of care that women seek out, from prenatal education, lactation support, and mother and baby support groups. We are unwavering in our dedication to providing strong women's health services, offering choices in how they receive their care. More than ever, we know how important this is to women in our community. Our services are extensive as we seek to meet the diverse needs of our community. For example, we have a program run by social workers that offers comprehensive support to teens and young moms before, during, and after pregnancy. We also have a program that provides support for pregnant and parenting women with a history of substance use disorder. There will be no interruption to or loss of comprehensive community-based obstetrics or gynecological care in this area. We want to reassure our community that access to OB/GYN services will continue to be available at Beverly Hospital. As Tom mentioned, we are working with our birth center to maintain appropriate staffing for outpatient visits to continue through September 8th. We will continue to support all births at Beverly Hospital. At the same time, we are working with the birth center patients to seamlessly transfer their care to the practices of their choice and will continue to serve women throughout the North Shore. Thank you for your time. We hope that what we have discussed today shows our commitment to our community and what we are doing, and that we are doing everything possible to limit the impact of this decision. Thank you.
Thank you. Again, thank you. We will now begin taking comments from state and local elected officials. For those folks that are now going to come up, if you can use the podium in front of me, that would be great. Our first speaker is Senator Joan Lovely.
Thank you and good evening, everyone, and thank you, everyone, for being here this evening. We know how important this is to you, so thank you. This letter is addressed to the Commissioner of the DPH, Commissioner Cook. Dear Commissioner Cook, thank you for the opportunity to be heard regarding the closure of the North Shore Birth Center located on the campus of Beverly Hospital. As today's State Senator for Beverly in the 2nd Essex District, as the Senate Chair of the Ellen Story Commission on Postpartum Depression, and the Senate Chair of the Massachusetts Caucus of Women Legislators, I am deeply disappointed at the prospect of losing this valuable option for birthing individuals across the North Shore. Birth centers are an important part of the Commonwealth's perinatal care system. Those who receive prenatal care and GYN services at the birth center have been shown to have lower rates of preterm and low birth weight infants, and lower rates of preterm and low birth weight infants. So lower rates, sorry about that. In addition, they have lower rates of cesarean sections than their peers. These improved outcomes often come at a lower cost to patients than if treated in a hospital setting. As Massachusetts is now the most expensive state in the country in which to give birth, this cost savings is incredibly important. Just this past June, I had the opportunity to meet with Hospital President Sands and Vice President and Chief Nursing Officer Perrin, together with the delegation, to discuss the impending closure. I want to just name from the delegation who was present. We have Senator Creighton, who is here this evening, Representative Paracella, Representative Bellacito, Representative Walsh, Representative Kearns, and Representative Tucker, and Senator Lewis, who were able to be a part of that meeting. During our meeting, they were able to walk us through the timeline of the birth center and the reasons for the decision to ultimately close the facility. as you had heard just earlier. During that meeting, I requested that they delay the closure of the birth center to see if the staffing issues could be resolved in the future. We know we have a staffing crisis across our entire medical system. We are aware that they would need 8 full-time employees for the birth center to be fully operational, and at closure, they had 4. We are aware that there's currently no medical director and no midwife director, as required by regulation. However, it is my hope and our hope that if the DPH closure is paused, that we could work together to address staffing needs as our workforce recovers from the COVID-19 pandemic. And the legislature is working very hard to help make that happen. For the more than 200 individuals receiving care at the birth center, the closure of this facility is the loss of an alternative care and birthing experience that better suits their needs than a traditional hospital setting. While I understand the hospital's concerns and desire to move into this direction, I continue to advocate for delayed closure to see if these shortages can be addressed moving forward. So birthing individuals and their families on the North Shore will continue to have this out-of-hospital birth option. I do want to thank President Sands and Vice President Perrin for their willingness to engage on this issue with our offices. I know that all of us are greatly concerned with the health and well-being of our families, new parents, and babies. It is my hope that we can work together to resolve this issue rather than shuttering this valuable resource for the North Shore that will send our birthing families to New Hampshire or Western Massachusetts to seek the desired outcome of home birth experience. Sending our birthing families away should not be an option. I want to just again say thank you to DPH for having this public hearing this evening. I look forward to hearing from not only my colleagues, but more importantly, from members of the audience who have birthed at this center, who have had great experiences at this center, and why the center should continue to be able to operate. Maybe not now, maybe when we can, again, pause this closure at the DPH level and be able to see that our workforce shortage, many initiatives that we have engaged in as a legislature to be able to bring our workforce shortage in the medical field back, including midwives, including the very people that would be employed at this birth center. Give this the opportunity for us to recover from COVID-19. Please don't close the birth center. Thank you.
Thank you, Senator. Our next speaker will be Senator Brendan Creighton.
First, just want to say thank you to DPH for holding this, to all of you for attending, my constituents and other residents of the North Shore, to Senator Lovely, such a strong partner in the legislature on many things, but in particular when it comes to women's health. And I stand here as the state representative of the 3rd Essex District, representing the communities of Lynn, Lynnfield, Marblehead, Nahant, Saugus, and Swampscott. Unfortunately, Rep. Dan Cahill and Rep. Pete Capano cannot be here. They both represent Lynn as well, but they wanted to. I will speak on their behalf tonight. We will be sending in written testimony as well. Thank you again for this opportunity. We are here because Beth Israel Leahy Health announced that it will permanently close the North Shore Birthing Center in Beverly Hospital by September 9th after 42 years of service. Once again, activists, coalitions, and legislatures are fighting to keep the center open. Today at this hearing, we hope to unpack the effects of this closure will have on women and families in the community. I am strongly in opposition to the closure, and I reiterate Senator Lovely's respectful request to temporarily pause this closure. The closure of the North Shore Birthing Center and the elimination of midwife-led care will have detrimental impacts on the maternal and infant health in the community and limit access to care. There will be a disparate impact on low-income families. Many people, as we know, pay out of pocket for birthing care, and the center is a low-cost option. According to the most recent data from the United States Department of Health and Human Services, the average cost to have a baby in a hospital is $16,884. In comparison to labor and delivery at a birthing center costs on average $3,000 to $4,000. Obviously a significant savings. And for low and moderate risk patients, birth centers produce better outcomes for moms and babies than hospitals do. The nearest available birthing center care is available in Salem, New Hampshire, which is not a feasible option for most birth center patients. Beverly Hospital's plans to address these negative impacts are insufficient. By definition, out-of-hospital birthing experiences and well care cannot be replicated in a hospital. There are stark differences between a birth center and a hospital, and between physician-led and midwife-led models of care. Essex County OBGYN does not offer an equivalent quality of care to patients seeking birth center care. Women must have the right to make their own medical decisions. The closure of the birth center is an attack on that right. In the wake of the Roe Casey reversal, a woman should have an expansion of choices and protection of existing choices when it comes to reproductive decisions. Now more than ever is a poor time to limit these care options. The birthing center is supported by local officials, as you've seen here, state officials. I know we have some mayors here as well. I would like to close just to say thank you to all of those who reached out to my office, in particular a friend who first introduced me to this issue, Catherine Rushforth, who really has educated me over the years on midwifery and has really shown where we've fallen short in Massachusetts. I'm proud of the work the legislature is doing to protect women's reproductive health, but we have fallen short in supporting midwife care. We need to do better. This is a clear opportunity where we can do better. The women and the families of the North Shore deserve just that. Thank you.
Thank you, Senator. Our next speaker is Representative Jamie Bellacito.
I thank you for the opportunity to address the crowd here tonight. Hello, mamas. Hello, babies. Hello, fierce advocates and those who do the work of birthing our next generation. You're right here tonight. And to Kit Cox, the Grampy of all babies, right here. I'd like to say thank you to my mentor, my colleague, my friend, and my Senator, Joan Lovely. She is the best. And Joan and I met each other by way of my own dealings with this hospital on particularly maternal health issues. So this speaks home. Hits home, rather. I am going to be a little bit lengthy, and that is because when it comes to maternal health, you have the guru right here. Not many of you know that, but I am a national leader on maternal health, and so I have a lot of thoughts when it comes to this particular issue, and I'm very happy to bring it here this evening. Thank you. The discussion of the closure of the Beverly Birth Center is incredibly important to this district, to the Commonwealth. It's one of the only places where surgical and medical intervention are left at the door. And for those of us who have experienced inductions, emergency cesareans, et cetera, I can't say enough that having this option is medically, or forget the medical part, personally necessary. Best as I know, I could be wrong, MIT could be developing a bionic uterus as we speak. But I'm pretty sure women are the only ones who have been birthing and birthing people since man walked this earth, and we didn't require medical intervention unless necessary. And I think that we can trust women. Trust women. So I am the state representative for the 4th Essex. My district consists of my hometown of Topsfield, Hamilton, Ipswich, Manchester, Rowley, and Wenham. I'm a previous resident of Beverly, Mayor Cahill. You know I'm a fan. I am a mother of 2 girls. I'm a former commissioner on the Ellen Story Postpartum Depression Commission appointed by my Senator, Joan Lovely. I'm also the founder and former policy director of the Maternal Mental Health Leadership Alliance based in Washington, D.C., a nonprofit dedicated solely to positive policy outcomes for pregnant and postpartum women as it relates to their mental health. And I'll tell you something right now, this closure is going to add to that. I am the former advocacy director for the National Coalition of Maternal Mental Health. For the past 10 years, my entire career has been focused on maternal health policy at the federal and state level. As a mom who almost lost my life to debilitating maternal mental health complications, I've dedicated myself to advocate for all the mamas and the dads here and the babies and for policies that affect positively affecting the most vulnerable of our populations, and that's pregnant and postpartum families. It's as common sense and as American as baseball and apple pie, if you ask me, is taking care of families. I have worked on the first ever maternal mental health legislation passed and funded by the federal government. I've worked with the past 3 federal administrations on how we take care of and treat pregnant, birthing, and postpartum women. It is actually a Biden-Harris priority when it comes to birth centers and taking care of Black, brown, and Indigenous women and pregnant women and babies, alongside national legislators like Congresswoman Catherine Clark, Senator Warren, Senator Markey, Congressman Seth Moulton, and national maternal health leaders like Stacey Stewart, CEO and president of the National March of Dimes, and my friend and warrior Charles Johnson, father of 2, husband of Kira Johnson, who lost her life after a botched cesarean section at Mount Sinai in Los Angeles. We have addressed and changed how pregnant and postpartum families are treated by way of increased mental health screenings, support systems, requiring cultural competency and implicit bias training for providers, and the implementation of state-level maternal mortality review boards, which I will submit to this hearing tonight. Our elephant in the room when it comes to Massachusetts is that women are dying postpartum by way of maternal and substance use comorbidities, which is why I am so thankful that I have my senator at the helm of the Postpartum Commission, and midwives and doulas and birthing centers take care of those moms and those dads and those babies to make sure that nobody loses their life, because 100% of these deaths are preventable and treatable. And I'd like to submit this. I'll bring this up here.
Thank you. Thank you.
2 decades of rising maternal mortality rates. Our country has the highest cesarean section rates, lack of adequate postpartum care, lack of adequate home visiting support. We don't have a national paid leave program. Society expects parents to take short-term disability to become a new parent, or no time off at all. Prior to COVID, an infant formula shortage, pregnant and birthing people were already facing social factors that contributed to poor maternal health outcomes: air pollution, housing insecurity, job instability. We have another stark reality. Within the dismal facts and figures we continue to receive, as we're finally starting to take a look at the value that women bring when it comes to birthing our next society in to take care of us in our communities, is racism. Black, brown, and Indigenous women are losing their lives 3 to 4 times higher during pregnancy and postpartum because of all the things I've stated here earlier. These realities have led to higher hospital readmission rates prior to COVID, and outright negligence when a patient is not listened to nor seen by a medical provider and die from common and treatable conditions like hypertension or postpartum infections. CDC estimates 66% of these maternal mortality rates are preventable. My factual and anecdotal information directly correlate to why we're here tonight. Our own Commonwealth created a task force on maternal health equity, of which I will submit that to this panel as well. If you are to take a look at the leaders that reside here in this Commonwealth and even in our district, it's all right here in black and white, an entire commission dedicated to addressing health inequities. And if you are to take a look at page 16, accessible and affordable birthing centers is one of their recommendations right here. And that is part of what we need in our communities. 42 years this has been here, and I remember when I moved to Beverly, it must have been 2007, they tried to close it before. And how many births have they, actually want to know this, how many births have they had since 2007 till now? I do want to know that. Births are declining. but that comes and goes. Just like when we talk about it in our town meetings. Oh, you know, the schools, not enough kids coming in, we got to close this down. Next thing you know, we're building a brand new school because there's too many kids. That's just the way it goes. And when you close the birthing center in December and don't tell leadership that could help you address your workforce till May, my question is, why was there not a partnership on that? I stand here knowing the top certified nurse midwives in the United States. You actually have one, a top leader in this space, Dr. Neil Shaw of Beth Israel, whom I'm also going to submit his testimony to this panel tonight as well, stating unequivocally that this is a short-term solution without a long-term plan. You have national experts in the birthing space right here on your leadership team at Beth Israel. And you also have, again, you know what a fan I am of my senator. You have two of the most well-informed folks that could help you with planning out your workforce so that we didn't get to this point, and I want to offer that, continually offer that. I think also, as I stand here, and I know that being a product of the state university system that I am at Salem State, and speaking with North Shore Community College and speaking with Salem State, we could work with you to address that workforce shortage. We have the labor and delivery nurses coming from our state university system, and it's low-hanging fruit for us to be able to work with our local universities, our local community colleges, and get that taken care of. My question is, why did it take so long? How can we help now? Because I am here to request that we do put a pause. Again, I always say this, Theo Epstein knew he had to trade Nomar Garciaparra to win the World Series. We have to think long ball. We can't think just immediate. And we need to be thinking about what this looks like in 10 to 20 years. This is a community hospital. We have, although I represent a 94% white district, we have Black, Brown, and Indigenous and LGBTQI folks who are looking to have safe births. As we see that racism and gender discrimination and a whole myriad of other issues are affecting our communities, this is a safe place. This is a safe place, and people deserve to have that care. And I would ask for us to continue to move forward. I also would like to submit to the record Massachusetts maternal services are central to racial and social justice. And I think that we really need to be cognizant that although we think, oh, a birthing center, it's nice. It's a nice to have. No, it's a need to have. And so I offer my services as a mom, I offer my services as a legislator, and I offer my services as someone who's dedicated to making sure that we get to the other side. Beverly Birth Center improves communities' health, enhances patient experiences, reduces costs. Thank you to the senator from Lynn for pointing that out. It advances health equity with choice and safety. Beth Israel Beverly Leahy have a Diversity, Equity, and Inclusion Council whose mission statement is fostering a culture of diversity, equity, and inclusion is essential to our mission. Promoting quality care for everyone allows us to best serve the more than 1 million people who rely on us for care and to advance health equity across our communities. And that's what we're asking for here tonight. Thank you very much.
Thank you, Representative. Our next speaker is Liam Cahill from the Office of Representative Gerald Paracella.
First of all, I don't know how I'm going to follow that up. My name's Liam Cahill. I'm the aide for Rep. Jerry Paracella. Unfortunately, he's in Boston today, so he couldn't make it, but he wanted me to read the testimony that he submitted earlier today. I'm writing today to express my deep concern with the pending closure of the North Shore Birth Center located at Beverly Hospital and currently operated by Beth Israel Leahy Health. For over 4 decades, North Shore Birth Center has served as a critical tool for mothers across the region who are seeking midwife services during their pregnancies. It is my understanding that there are no other birthing centers like the one at Beverly Hospital in eastern Massachusetts, leading to the most birth center births in the Commonwealth occurring at this facility. Ever since the announcement of the closure, I've heard from constituents and others across the North Shore who have used the birth center to receive prenatal, postnatal, and gynecological care in a safe and non-clinical setting. While Beverly Hospital claims it can reproduce the setting in a hospital, it is clear that is not what patients of the birth center want and prefer the patient-centered, low-intervention care that the center provides. Additionally, Beverly Hospital claims that the reasoning for the closure is due to decreased births at the center and staffing shortages. Despite these claims, and from data from Beth Israel Leahy, births at the North Shore Birth Center have increased over the past 3 years, while births at the hospital declined during the same time frame. By closing the birth center, women in eastern Massachusetts would no longer have a standalone facility providing midwife services. This closure disproportionately affects those who are seeking an affordable option for childbirth, as well as women of color who are statistically at a heightened risk for complications during childbirth. Considering the events of recent weeks and months in this nation, we should be working as a Commonwealth to remove barriers to maternal services, not increase them. It is imperative that we support women who want to use midwife services and ensure they can receive the affordable, quality maternal care they deserve. I ask that when DPH reviews the proposed closure and ensures measures have been put in place to minimize the impact on the community and address the concerns that have been brought to your attention by the residents here tonight and all those that have reached out. And I know I join Representative Bellacito, Senator Lovely, Rep. Creighton in saying that Rep. Parasola is committed to doing whatever we can to work with the hospital to ensure that we can find a long-term solution to this problem. Thank you.
Thanks, Mr. Cahill. Our next speaker is the Mayor of Beverly, Michael Cahill.
Thank you, Mr. Director. Let me get my glasses here. I want to thank you and your colleagues, and I want to thank everybody who's here tonight. This passion and this advocacy is exactly what's needed. Thank you all so much for educating us and bringing us together. I want to talk for just a couple minutes about the Massachusetts Special Commission on Racial Inequities and Maternal Health, as Representative Bellacito referred to, and I think you held it up too. It's right there. This is, I think, of critical importance here tonight. The Massachusetts Special Commission on Racial Inequities and Maternal Health just submitted its report in May of this year. It calls for creation of more birth centers in Massachusetts, as well as modernization of the regulations governing birth centers and evaluating financial and structural barriers to establishing birth centers. Why does it recommend these actions? The Commission cited evidence showing that birth centers reduce the number of interventions used during labor and delivery, while improving patient experience, yielding positive health outcomes, and lowering costs. The Commission further finds that for birth centers to succeed in providing maternal care and delivery for mothers with low-risk pregnancies, quote, health system integration is paramount, with advantages that include a wide perinatal safety net and few delays in the transfer of care in the instance the pregnant person desire epidural analgesia for prolonged labor, or the birthing person or baby require advanced interventions only capable in a hospital setting, end quote. This sounds like exactly what we in Beverly already have in the North Shore Birth Center. On the campus of and affiliated with Beverly Hospital. It seems now is not the time to dismantle a resource that the women of this region and state need more, not less of. So I respectfully and sincerely urge you members of the committee in your role on behalf of the people and the Department of Public Health to do everything you can to keep the center open. And I also respectfully and sincerely urge the leadership at Beth Israel Lahey Health to reconsider their determination to close the North Shore Birth Center, and instead to work with interested parties to preserve and strengthen this resource, give a chance for the Massachusetts Special Commission's recommendations to be implemented, and help to show the way forward for equitable maternal health care in Massachusetts. Thank you all for your time and your consideration tonight.
Thank you, Mayor. Our next speaker is Lynn Mayor Jared Nicholson.
Thank you. Good evening, Mr. Director. Good evening, everyone. Thank you, Department of Public Health, for hosting this hearing. Thank you, all of you, for being here. Unlike Representative Bellacito, I am not a maternal health guru. That was very impressive. However, I am married to a maternal health guru. My wife is a midwife. And we actually had our son with the North Shore Birth Center midwives. As many of you know, the city of Lynn is the largest city in Essex County, and our population is majority people of color. Our poverty rate is almost twice that of Essex County. Lynn is also continually on the losing end of healthcare access decisions like the one being made tonight. A generation ago, the city of Lynn had 2 fully functioning hospitals. Today, we have 0. Because of legacies of racism and inequality, families in Lynn are more at risk for obstetrical and neonatal outcomes, including preterm birth, low birth weight babies, and higher risks of cesarean sections. As many have mentioned tonight, and more will present, we know that birth center care is associated with improved outcomes, particularly for low-income people and people of color, as well as substantial healthcare savings. And generally, out-of-hospital birth, also people refer to as community birth, not only improves obstetrical outcomes for people of color, but is shown to have higher patient satisfaction and less experiences of mistreatment and discrimination. In closing and making the decision to close the North Shore Birth Center, you would eliminate community birth options for low-income women in our community. Families with more resources may be able to pay for it out of pocket for a home birth, or maybe their private insurance would reimburse them for going to a birth center in New Hampshire. But that's just not an option for people who are on Mass Health or don't have the $5,000 to do a home birth themselves. As you've also heard, this decision would run directly counter to proposed approaches statewide from the Massachusetts Commission on Racial Inequities in Maternal Health and the Massachusetts Health Policy Commission, which both call for more birth centers. I absolutely understand the nationwide staffing issues that face this industry and really across industries. But I think the Department of Public Health needs to really look hard at that reality that is affecting all aspects of healthcare, to ask, once again, women's health and care for birthing people to bear the brunt of those forces. If we are truly committed to health equity, pregnant and birthing people in Lynn deserve more options on where to get care and give birth, not fewer. Thank you again for the opportunity to share these comments, and thank you so much to all of reached out to my office, everyone in the city of Lynn who has shared their story and is fighting for this access. Thank you.
Thank you, Mayor. Our next speaker this evening is Beverly City Councilor Hannah Bowen.
Thank you. I want to thank everyone for coming out to Beverly tonight. You are all welcome. We care about everything that is being said tonight. And the Beverly City Council prepared a letter that all 9 councilors signed on to back at the beginning of June to share our concerns about this decision. It's been filed, but I just wanted to read 2 short sections from it. We join our voices with others in our Beverly community and across the North Shore, recognizing that patients seek out the birth center and benefit from its midwifery care, both for well visits that support health and for birthing support, from an area far broader and wider than the North Shore alone. to call upon Beverly Hospital to reconsider its proposed plan to discontinue outpatient birth center care. We talk about the same reasons that have already been shared tonight and that you will hear articulately from the large group behind me. And then close by saying, it is our hope that the leadership of Beverly Hospital find a way to creatively envision how the model of having a freestanding birth center, operational and thriving, within the Beverly Hospital campus and in our community can best be supported now and into the future. We commit to adding not only our voices in support of this work, but also to working as partners in whatever way possible to help support this effort. And so I'm heartened by the fact that we are in a public hearing. I appreciate the Department of Public Health for hosting with simultaneous interpretation, with transcription, with broadcast on BevCam, so that it can be a community decision. Thank you for that.
Thank you, Councilor. We will now begin taking comments from the public. We ask that each person who wishes to speak do so only once. Please clearly state and spell your first and last names, and that you please limit your comments to 3 minutes if possible, so that there will be time for all who wish to speak to do so. Again, as I stated earlier, if you would prefer to submit written comments, you may do so by email to hfllicenseaction@mass.gov or by fax to 617-753-8089. The department will accept written comments through midnight tonight, July 20th. Our first speaker this evening is Karen Letourneau. After that is Emily Anesta.
Good evening. Thank you so much for holding this hearing and for allowing me the opportunity to speak in support of the birth center. My name is Karen, Karen, Letourneau, Letourneau.
Thank you.
And I live in Newburyport. I find I am uniquely qualified to testify. First of all, I've been a nurse practitioner for 40 years, and I specialize in women's health care, very proudly. But more significantly, I delivered my firstborn 38 years ago at the Beverly Birthing Center. 4 years later, I gave birth to my second child in a hospital. So I will compare and contrast the care in the two different facilities for you. First, let me say that before I ever had thoughts about becoming a mom, the idea of midwifery always appealed to me. After all, from the beginning of time, midwives were the people who helped women bring their babies into this world. I was going to say something about how then doctors decided to take over and interventions started and care went downhill, but I'm going to table that. I don't want to offend my medical colleagues. So when the advanced practice nursing role was developed, certified nurse midwives were part of that movement. When I tell people I am a nurse practitioner, I always am pleased to hear that people feel that they get better care by nurse practitioners, as we are seen as listening more and taking more time. And the same is definitely true of certified nurse midwives. Working as a nurse, before I became a nurse practitioner in a hospital, I saw firsthand how women, especially poor and minority women, are often disrespected and not heard. Therefore, when I was expecting my first baby, I knew I did not want to deliver in a hospital. I was delighted to discover the existence of a birth center 30 minutes from my home. If not for the birth center, I would have chosen a home birth, which isn't always the best option for women. Sometimes it can be. My fear is that if the birth center closes more women will choose home births, and that could certainly lead to an increase in maternal and fetal mortality. So back to my story. Receiving my care at the Beverly Birth Center, I felt respected, listened to, cared for. I could almost say loved, really. You just connect with your nurse midwives on such an unbelievable level that you cannot connect with a medical provider, especially most medical practices. You're seeing different people all the time, and then you don't know who you're going to get for your delivery. You know when you go to the birth center that person delivering your baby, or I should say helping you to deliver your baby, is somebody you know and trust, and dare I say, loves you and wishes you the best. So so my care, obviously, at the birth center, I could go on and on, but I won't, was wonderful. And by the way, I was supposed to, my due date was December 23rd, and I went into labor on the 23rd, but I was in labor for 2 days, and because I made the decision with the midwives, and my baby and I were fine, to continue through labor without any intervention, he was born on Christmas Day. And Brendan was meant to be born on Christmas Day, and he would have been born on the 24th if I had chosen a hospital birth. I guarantee it. Anyway, it was a starkly different experience in the two different facilities. And I don't have any specific complaints about the care I received at the OBs or for the hospital birth. But I didn't feel really respected. I didn't feel listened to. I felt like I was a case that needed to be gotten through. And at the birth center, I was listened to, I was respected, I was in control. And as a nurse and a nurse practitioner, I need to be in control. And I think that's why I couldn't bring myself to give birth in a hospital the first time around. So, and I felt 100% supported at the birth center. More and more, healthcare is big business. Healthcare costs are ridiculous. Care at the birth center is not only as good and often superior, but the cost to patients, insurers, and you and I is significantly less, as has already been addressed. I ask you, why in a free-thinking state like Massachusetts that prides itself on excellent health care and forward-thinking and innovative care would even consider closing a facility which offers greater choice, better care, equally good, if not better outcomes, for much less cost? People, if the birth center closes, we will never get it back. In closing, and thank you for bearing with me and listening, the North Shore Birth Center is a treasure. The care patients receive cannot be replicated anywhere, and it would be a travesty to take away this very unique option. Thank you for listening.
Thank you, Ms. Letourneau.
I'm here today to urge that North Shore Birth Center remain open, as it uniquely provides access to out-of-hospital birth in this region of the state. Birth has been hyper-medicalized in the United States, resulting in the worst maternal mortality rate in the developed world, significant and increasing racial inequities in maternal and infant health, and high rates of racism, coercion, abuse, mistreatment, and disrespect of birthing people by medical providers. These deficiencies in our maternal health care system are well documented, and also well documented is the clear evidence that out-of-hospital midwifery care improves both the outcomes and the experience of care. You already heard that 2 state commissions, the Massachusetts Health Policy Commission and the Special Commission on Racial Inequities in Maternal Health have both recently recommended expanding access to birth centers in Massachusetts to improve outcomes, reduce racial inequities, and lower healthcare costs. But we are going backwards. Birth is an intensely personal and momentous experience. Most pregnant people are good candidates for out-of-hospital midwifery care, where birth is treated as the normal physiologic process and family-centered experience that it is. Many birthing people want access to out-of-hospital birthing options. In fact, demand for out-of-hospital births in Massachusetts has skyrocketed, with the home birth rate rising by 47% from 2019 to 2020. Everyone deserves to have the choice of where they give birth, and unfortunately in Massachusetts, too few of us do have that choice. Home births remain out of reach for most families, as they are not covered by Medicaid and very rarely by insurance. Birth centers are an accessible option for community-based care and out-of-hospital birth. Closing this birth center leaves our state with just one birth center operating out in Northampton. There are 400 birth centers across the U.S. While Massachusetts prides itself on exceptional health care and reproductive choice, we are in the bottom 1/3 of states for midwifery integration, and the closing of this birth center puts us in the bottom 20% of states for number of birth centers relative to our birth rate. We have one birth center, or will have one left if this closes, while New Hampshire has 4, Maine has 3, California has 56, and Texas has 92. As we fight for our reproductive freedom on so many fronts, don't make it harder for those planning to give birth to have access to this choice. I implore Beverly Hospital and DPH to keep North Shore Birth Center open, and I ask DPH to support and enable more birth centers to open and be able to operate sustainably in Massachusetts.
Thank you, Mrs. Anesta. Our next speaker will be Representative Sally Cairns, and then after that is Monica Joyce.
Oh, I know Monica Joyce. Hey, Monica. Well, good evening. Thank you, and I appreciate the chance to be heard tonight. I am sorry that I was detained and had another meeting. But I wanted to take the opportunity to come and appeal to you as you consider the request, I guess, by Beverly Hospital, Beth Israel Lahey, to close the North Shore Birth Center. This is an essential service, and I believe it is your task tonight to determine how essential. And I think what you're hearing tells you it is absolutely vital. As you're hearing, I said, in so many stories and in different ways, this is a vital service to the North Shore. I urge you and the leadership of Beth Israel Lahey to commit the time and the resources to finding an alternative so that North Shore women will continue to have this option. The maternal health crisis, as you've heard, I know my other colleagues have articulated it perhaps better than I, it's an alarming situation. We have the highest rate of maternal mortality compared with other high-income countries, and Black women are 3 times as likely to die from pregnancy-related causes as white women. That is unacceptable. The announcement by Beverly Hospital, and I will say, I had my son at Beverly Hospital. Great experience. That's just me. The maternal health crisis tells us that women have many feelings, and many women don't want that kind of a birth experience. The announcement by Beverly to close the birth center came on the heels of the Mass Health Policy Commission's January 22 report showing the increased use of midwifery is associated with improved patient outcomes, including lower rates of maternal and infant mortality, and, by the way, it costs less than a hospital birth. The care provided in birth centers, we know this, contributes to positive outcomes for parents and babies. Clearly, Beverly Hospital believed that to be true when it applied 42 years ago and went through the determination of need process saying, we want to operate a birth center. Now, I'm sorry that the landscape of healthcare is difficult. I understand that. But I firmly believe that both DPH, the Commonwealth, and Beverly and Leahy, Beth Israel Leahy, have an obligation here. You cannot just decide, oh, it's not profitable, we're not going to do this anymore. No, 42 years ago, it was what you said you could do, or what the hospital said they would do, and they've done that. So now I am asking for you to find the path forward, to partner with other entities, and I'm asking you, DPH, to declare this an essential service. And to encourage Beverly and Beth Israel Leahy, and Tom Sands has been, an open door, wonderful to converse with and have dialogue with. There has to be a way here, and we have to find it. And so I'm asking you to, in your role, gentlemen, as DPH, to declare this an essential healthcare service provided by the Birth Center of the North Shore. I thank you.
Thank you, Representative. Our next speaker is Monica Joyce, and after that is Beverly City Councilor Estelle Rand.
Hi there, my name is Monica Joyce. I live in Ipswich now, and I went to Danvers High School and graduated with Sally. I've been a nurse since 1980 and a practicing certified nurse midwife for over 20 years. I currently practice at Boston Medical Center, where I'm an assistant professor in the Boston University School of Medicine. I'm in a unique position to discuss the differences in care given at midwifery-led care in birth centers and hospital-based practices. I've worked in both settings as a nurse and a midwife, and I've also enjoyed care for midwives for the births of my children in both of those places. Freestanding birth centers have been studied widely. They've been shown again and again to give a high standard of care with less C-sections and good outcomes. There is a high level of satisfaction from the women and their families that choose this setting. The birth center model is deeply personal and respects normal physiologic birth that women find deeply satisfying. In my own family, when our third child was born, we found it to be an extraordinarily rewarding experience. What I learned from the midwives at the birth center, I've carried forward in my practice at the hospital. However, as a hospital midwife, I'm not able to give the same type of care simply because the settings are structured so very differently. I wish that more families had freestanding birth centers available to them. In fact, in Boston, there is this sort of birth center being developed, the Neighborhood Birth Center. And this is because of the need in the community to offer more options to their birthing families in their neighborhoods. Our community birth center on the North Shore is slated to shut September 8th. After more than 4 decades and nearly 10,000 births, this service will no longer be available. There ought to be more choices for people where they get their care and who gives that care to them. We shouldn't have to be sending women to Northampton or New Hampshire or Boston who desire birth center care. I implore Tom Sands, president of Beverly and Addison Gilbert Hospitals, and Dr. Kevin Tabb, President and CEO of Beth Israel Lahey Health, to acknowledge the science and the evidence of birth center outcomes and to continue to support this fine model instead of closing this valuable service and eliminating safe birthing choices for people in our community, in my community. Finally, 42 years and nearly 10,000 births, certainly something good has been happening at the North Shore Birth Center. Closing it will be going backwards. Let's keep this safe and satisfying option going for the families in our community. Let's find a way to support our birth center, to help it grow, and to make it even stronger. Thank you very much.
Thank you, Ms. Joyce. Our next speaker is Beverly City Councilor Estelle Rand, and then Katie Murphy.
Thank you. Good evening. And it's really wonderful to see, strange though that it's in reflection. It's really wonderful to see so many people here to speak in support of choice for young families and especially for women. I am also, would just like to take a moment to really give a warm welcome to all the children here and the babies. So thank you for being here. We all started out like them. So, and if you're lucky, you got to have that experience at the North Shore Birth Center like I did, working with midwives for both of my births, one at the hospital and one at the birth center. So I can't say it's a unique experience in this room because we've already heard from a number of people that have had that experience. What I can say is that it was key to my own family's well-being and health. And I can just share with you anecdotally that I took a bus to the birth center with my toddler when I was pregnant with my daughter. I didn't have a car. I lived in downtown Beverly before I became a city councilor, and that was a community service that cannot be replicated, I think, by the hospital or in some of the other communities further away from the birth center. You've heard so much tonight about the value, the dollars, the difference in hospital care cost versus birth center costs. And what I've really heard tonight is that there's an obstacle in staffing for the birth center. And I don't believe that justifies closing the birth center. I also have heard from all of the elected officials in the room that they're willing to help at a state level, at a federal level, to overcome these obstacles. So I would just urge the hospital to please take us all up on that. And I would urge DPH to please take these anecdotes and take these facts and declare the birth center an essential part of our community in this region. Thank you very much.
Thank you, Councilor. Our next speaker is Katie Murphy, and then Kelly, and I'm going to say this wrong, Dives. Thank you.
Hi, nice to see you again.
Hi, Katie.
My name's Katie Murphy, K-A-T-I-E-M-U-R-P-H-Y, and I'm the president of the Massachusetts Nurses Association, and I work as an ICU nurse at the Brigham and Women's Hospital. And I cannot express to you how heartbroken I am to be here this evening speaking at yet another DPH hearing regarding the closure of an essential healthcare service. During my time as M&A president, I have spoken at more of these hearings than I care to count. Each time I'm hopeful that the service positioned for elimination will be saved, but so far, each time, I've been let down. Let's see if this time things are different, because I think so. This time, things really are different. For one thing, there has been the most overwhelming outpouring of local support for saving a hospital service that I have ever seen. Right? This coalition speaks volumes about how valued, utilized, and essential the birth center is. The other reason I believe things can end differently in this instance is because the DPH has an example already, a terrible example of what can happen to a community, no, an entire region, where maternity services are eliminated by local hospital networks. Because of the decision by so many hospitals to eliminate their maternity services, the south coast of Massachusetts has become a maternity desert. Services have been lost at Quincy, Morton, Toby, Falmouth, and Norwood, to name just a few. The era of closing maternal services in Massachusetts must come to an end. Instead, maternal services must be preserved, expanded, and improved for all women in the Commonwealth. We have to ensure that all women have access to appropriate, affordable, and culturally competent prenatal, delivery, and prenatal and postnatal care. And we need to know that they can get that care within reasonable geographic proximity to their homes. Before I finish, I want to mention just two final things. The disappearance of maternal services is an important issue for the MNA and its 25,000 members. Recently, we completed and published a white paper called Maternal Services Are Central to Racial and Social Justice, as I believe the representative mentioned. Thank you. It details much of what has previously been mentioned, but it also goes into great detail on what must be done to protect the Commonwealth's expectant mothers and their babies. This white paper is accessible on the web, and I can get you that address because we'll submit complete testimony on this. It's an excellent resource, and I encourage everyone, especially the decision makers behind this misguided plan, to read it. And lastly, the MNA knows what comes next in this process. We know that the DPH is completely limited in terms of stopping this proposed closure. If B.I. Leahy Health stays its course and callously shutters this center, the voters in Massachusetts must step up and pressure their elected officials to pass meaningful legislation that will prevent hospitals from closing essential services simply because they can. Thank you.
Thank you, Ms. Murphy.
And all three of my children were born under the special tender care of nurse midwives.
Our next speaker is Kelly Diver, sorry. And then our speaker after that is Senator Bruce Tarr.
Hello. I'm here to tell you today about my birth experience. I had my son at Beverly Hospital, and I am here to tell you that having a birth at the hospital cannot be a natural experience, even if you want it to be. I have some rather significant medical issues, so when we found out I was pregnant, we knew the hospital was probably the best decision for me. I knew I couldn't change my son's genetics, but I could still advocate for him to have as natural a birth as possible, so he would have a better start in life than I had. We wrote up a natural birth plan and took the Bradley method birthing class, which is extremely extensive, to be as prepared as possible. I knew birthing at a hospital might lead to interventions, so I labored at home for 8 hours until my water broke and we drove to the hospital. It was a long and challenging labor. I have major nerve issues, which were not triggering the right muscles to push the baby out, and he was sunny side up, as they called it. We were monitoring him and he was fine, but for some reason, the OB who was on duty at that time felt the need to stick her head in and tell me that if I didn't figure out how to push, that they were going to need to cut me open. This happened multiple times. I remember yelling at her, and my husband had to go out and have a conversation with her about leaving us alone. The midwives were finally able to help me figure out how to trigger the muscles to push, and 14 hours after I arrived at the hospital, my son was born. After the birth, I was unable to walk, and since my son was born on a Friday evening, no one was around to figure out that there was an issue. The nurses kept asking me to get up and walk, but I would hobble around and couldn't lift my feet. Monday morning, every kind of specialist imaginable was coming in and out of the room. I had a hard time keeping track of it all, but it was very evident that they wanted us to leave. Finally, they figured out that I had separated my pelvis in the delivery. The whole point of delivering in a hospital was that they could help me if I needed help, and it took 3 days for them to figure it out. Finally, a doctor came in and was checking on my son. She asked me why I didn't give him a vitamin K shot. I have a genetic blood clotting disorder that causes my blood to clot more easily. Vitamin K also does this. Our pediatrician had decided it would be safer to give an oral version. Even when given this info, the doctor proceeded to tell me that my son was going to die. I remember looking at my husband, and he knew I wanted to hurt this woman who had no idea about my medical history. I have never in my life been so dehumanized as in that moment. I told my husband that we were leaving now. I never got to change my son into this outfit that I had picked out to go home in. Beverly Hospital ruined this experience of bringing my son home. I have heard such amazing stories from people who have birthed at the birth center. Never once have I heard about issues like this. At the hospital, you are a number. It is how you are treated from the moment you walk in. That is their business model. It is how they make money. I'm now pregnant with my second, and I couldn't help but notice the turnover and reduced number of midwives associated with the hospital. If my experience shows anything, it is that the hospital does not care about anyone except their profit margins and are willing to step on patients and staff to get there. If you take away the birth center, you are forcing women to go to the hospital or else birth at home. And after my last experience, I'm terrified about birthing at a hospital. Thank you.
Thank you, Ms. Tyver. Our next speaker is Senator Bruce Tarr, and then Keiko Zoll.
Well, thank you very much to everyone that is in the front of this room and everyone who is throughout this room for this opportunity to be able to speak to an issue that is of critical importance to all of us on the North Shore and, by example, all of us throughout the Commonwealth of Massachusetts. I want to thank the prior speaker and all of the speakers tonight who are sharing their personal experiences and giving us powerful testimony to the value of the birth center in their lives and to our health system. And I want to express my appreciation as well to you at the Department of Public Health for taking advantage of your authority in this matter to hold a public hearing and allow us all to come out for what I hope will be the beginning of a conversation rather than the end of a conversation. I personally have been the sponsor of many of the pieces of legislation that have been referred to up here relative to trying to give the department increased authority when faced with the closure of an essential healthcare service, and I intend to continue to pursue that legislative effort. But for tonight, I'm pleased to be here with all of my colleagues and who are public officials, both at the local level and at the state level, to talk about the fact that we need to examine this situation as not a binary choice between having nothing and having a very valuable resource in our healthcare system with regard to the birth center. This needs to be a situation where we chart new courses, where we innovate new solutions to the problems that we face, and that we find a way to address something that, quite frankly, is plaguing every element of our healthcare system, and that is a labor shortage. But the fact that we don't have sufficient labor in this instance or any other should not mean that we abandon essential healthcare services. It should mean that we redouble our efforts to find ways to address the issue. And like my colleagues, I am here to pledge my support every step of the way in that effort so that we can find a way to be able to continue to offer this service while maintaining the sustainability of a very valuable healthcare institution in the form of Beverly Hospital and Addison Gilbert Hospital, but that we seek to not limit choice, but to maintain choice and to allow folks to express their preference for something they clearly have valued for many years on the North Shore in terms of the choice to have their child at the birth center. Now, I do want to express my appreciation to the leadership of the hospital, and I want to thank Tom Sands for his outreach to the legislative delegation and the communication that he has provided us with. And I think that's an important foundational element of what needs to happen going forward. So my hope is that the DPH will not view this as a very simple black and white binary choice, but an opportunity to be a catalyst for the kind of innovation and change we need in our healthcare system, so that we can listen to the folks that have come out tonight and many, many more who have expressed a clear preference for this modality of healthcare. We cannot ignore that. Morally, we should not ignore that. And I hope that we will take it as our directive to all work together, perhaps in even unprecedented ways, to find a way forward. So my hope is that even though the authority that you have is limited in this matter statutorily, your authority as a regulator is enormous. And my hope is that you will use that to leverage the next conversation and the next conversation and the conversation after that. While we talk about increasing the supply of the medical professionals we need on the North Shore, not only midwives, but nurses and other kinds of providers, but that we talk about not allowing this to be a casualty among the many crises that we're going to face. And think about the power if we can save this particular modality for going forward and looking at all of the other problems that we face with regard to healthcare and labor shortages. This is a rare opportunity. I'm committed to working with you to take advantage of it, as I am with my colleagues and all of the people that cared enough to come out tonight. And I do want to say it's inspiring. It's inspiring to see this level of public engagement. I hope that we will harness it and use it to move forward, not as adversaries, not as opponents, but together in partners to make our healthcare system even stronger than it is today and more resilient to face the challenges that surely will come. Thank you for the opportunity to share a few thoughts.
Thank you, Senator Tarr. Our next speaker is Keiko Zoll, and after that is Ruthie Poole.
Good evening. Thank you for allowing me to offer public comment before the DPH tonight in deep opposition to the closure of the North Shore Birth Center. Before I continue, I want to take a moment to thank the woman who spoke 2 comments before me. I didn't catch your name. I'm horrified that that happened to you, and I'm so deeply sorry that you've had to relive that experience and trauma this evening. My name is Keiko Zoll, K-E-I-K-O, last name Zoll, Z as in zebra, O-L-L, and I am a resident of Swampscott. I speak tonight as a mother after infertility, a reproductive justice advocate, and founder of the grassroots group Swampscott for Roe v. Wade. I invite everyone here to learn more about our work at Swampscott4, the number 4, RoeVWade.com. The ironic timing of the closure of a 42-year-old birth center on the heels of the Supreme Court's overturning of Roe v. Wade, a 49-year-old law of the land protecting reproductive health access, is not lost on me, nor should it be lost on Beth Israel Lahey Health Leadership or DPH either. While an abortion rights organizer and activist may seem like an unlikely ally in the fight to save the North Shore Birth Center, the only freestanding birth center in eastern Massachusetts, abortion care is as much a critical aspect of maternal and fetal medicine as labor and delivery. The closure of a birth center is an act of reproductive injustice. Let me say that again. The closure of our birth center is an act of reproductive injustice. When Governor Charlie Baker signed Executive Order 600, protecting access to reproductive health care services in the Commonwealth, Massachusetts became a safe harbor state for any patient seeking safe, legal abortion care from within or outside of our state. As of this moment, abortion care is now illegal in 10 states, with an additional 13 states ready to ban abortions in the coming weeks. And it is one of these 10 states where abortion is now banned, Texas, to which we must look to see the disastrous and likely unconsidered implications of closing our North Shore Birth Center. According to a July 3rd Boston Globe article, which I will submit via email, quote, Texas is at the leading edge of what doctors fear will be a wave of more complicated pregnancies and sicker patients in the wake of the High Court's decision. The article continues, quote, some Texas providers are being forced to send patients out of state to receive care for complications that would have been handled locally before, including labor that begins before a fetus can survive outside the womb, end quote. Dr. Emily Hertzberg, a pediatrician with the Division of Neonatology and Newborn Medicine at Mass General for Children, told the Globe that people with medically complex pregnancies may come to Massachusetts to receive care in a place where abortion is one of the options discussed. She continued, quote, we get referrals from outside communities and outside states already. I do anticipate we may have an increased number, end quote. If President Sands is worried about how a national workforce shortage is impacting his hospital, then he should consider the remarks of Dr. Erica Werner, chief of obstetrics and gynecology at Tufts Medical Center and Tufts Medical School, who told the Globe, quote, "There absolutely will be more complicated pregnancies across the United States," end quote. No hospital or healthcare facility in Massachusetts, Beverly Hospital included, will not be immune from this increase in urgent patient need as more states ban abortion. While our birth center provides care to the North Shore and Cape Ann, and as the hospital's own chief nursing officer noted tonight, Beverly Hospital is committed to, quote, "the diverse needs of our community." And as Representative Bellacito reiterated that Beverly Hospital is a community hospital, it is not enough to be thinking of and serving merely our local communities in this frightening and regressive eradication of reproductive health care access in our nation. With Governor Baker's executive order that Massachusetts is now a safe harbor for safe legal abortion care seekers and providers, it is incumbent for all hospitals and medical practices in the Commonwealth to open their doors to out-of-state patients seeking the abortion care they need and deserve, and to those providers who can no longer practice in their own states. With a coming wave of out-of-state patients with complicated pregnancies, it is in Beth Israel Lahey's and Beverly Hospital's best interests to welcome both out-of-state high-risk patients and abortion providers who are licensed medical providers to their healthcare facilities, particularly for their financial interests. As President Sands stated this evening, quote, that Beverly Hospital has been considering its strategic short and long-term investments and ongoing medical provider staffing issues. Pregnant people with low risk and uncomplicated pregnancies could receive care at the North Shore Birth Center, freeing up those necessary and soon to be urgently needed beds for higher risk, complicated pregnancies and births. Out-of-state abortion providers who specialize in reproductive health could ameliorate Beverly Hospital's current staffing demands. By closing the birth center, Beverly Hospital is not only non-compliant with the spirit of Governor Baker's executive order, their decision flies in the face of it and does an injustice to all pregnant and birthing people who seek the care they need and deserve. In closing, I urge you, Commissioner Cook and President Sands, to halt the closure of this necessary birth center space in the name of reproductive and healthcare justice. Beth Israel Lahey Health and Beverly Hospital could be an exemplary national model for equitable healthcare delivery in this critical moment for reproductive healthcare access. The North Shore Birth Center must remain open and fully operational to preserve access as an essential health service and to do what is right and just for all. Thank you.
Thank you. As a reminder, please try and limit your comments to 3 minutes or less. There's a long list of people who wish to give comments, so if we can keep that in mind. Ruthie Poole, our next speaker after Ruthie Poole is Catherine Rushforth.
Good evening. My name is Ruthie Poole, and I live in Malden. Thank you for this opportunity to speak. When I went to Harvard Community Health Plan's Medford Center in 1995 to confirm my pregnancy, I told the nurse that I would like to work with midwives. She told me they had no midwives on staff, but she could refer me to the North Shore Birth Center in Beverly. I was delighted. From the moment I walked into the birth center for my first appointment to my last follow-up appointment after the birth of my second child, I was welcomed so warmly by the midwives and other birth center staff and treated with such professionalism, kindness, and compassion, and truly love. I really like that the previous speaker talked about love, because the place just exudes love. I just can't say enough good things about my experience with the birth center. Let me tell you some details about the birth of my 2 children. It was supported so well by the North Shore Birth Center midwives. Noah, my first baby, was very large, almost 10 pounds. After laboring at home, the midwives encouraged me to come to the birth center. I labored for many hours at the center, and then due to the presence of meconium, the midwife on duty transferred me over to the hospital. She literally wheeled me in a wheelchair across the parking lot. Like, how perfect was that? I didn't have to go by ambulance. she wheeled me over there, and she stayed with me and settled me in, and she stayed with my husband and I the whole time. In the middle of the night, many hours later, another midwife from the team relieved her. The obstetrician on duty checked me and considered a C-section. I'd been in labor for many, many hours. But the midwife helped me advocate to let me go longer, as the baby's heart rate was strong, and I was strong too. After more than 30 hours of labor, I gave birth to the most beautiful baby boy. In another hospital setting, without the support of the North Shore Birth Center midwives, I would have had a C-section, and probably my second child would have been delivered by C-section as well. Noah is now a 6'6", happy 26-year-old. My second child was born 2.5 years later at the birth center. I was almost 2 weeks after my due date on one of the hottest July days ever. The midwives used prostaglandin gel to stimulate my labor, and it worked. Rory was born a quick 4.5 hours later. As Linda Ann Elby, the attending midwife, said, after the first child shows the way to go, usually it's much quicker for the subsequent children. Linda Ann's attention to me and my specific needs went way above and beyond the call of duty. You see, Noah, my first child, was so big that I had significant tearing when he was born. To prevent this, Linda Ann spent hours massaging my perineum, which is a very private thing to do with someone, which resulted in absolutely no tears, even though Rory, my second baby, was 9 pounds, 14 ounces, even bigger than my first. I'm not sure anyone at any other birth facility other than the midwives at the North Shore Birth Center would give this type of difficult, personal, gentle, loving care. Rory is now a happy and healthy 24-year-old. I've recommended the North Shore Birth Center to so many friends and acquaintances for an incredibly positive, personalized, caring, and compassionate pregnancy and birth experience. I urge the Department of Public Health to reject Beverly Hospital Beth Israel Lahey's plan to close this very special, wonderful resource for women and growing families. Closing this unique and fantastic center would be such a loss to the North Shore and Massachusetts as a whole. Allowing Beverly Hospital Beth Israel Lahey to prioritize profits and short-term staffing problems over patients and families is just wrong. Thank you.
Thank you.
And I know you can't see it from here, but I brought this wonderful picture. It's actually in a bed, and you probably think I'm at home, but I'm at the birth center. And it's my toddler, Noah, came to hold his brother. His brother was only about 4 hours old then. And my whole family could be there, and then all my relatives came. And it's just a wonderful place. Thank you.
Thank you, Ms. Poole. Our next speaker is Catherine Rushforth, and then after that is Eugene DeClerk.
Hi, my name is Catherine Rushforth, Katherine, Rushforth, Rushfirth. I am a certified nurse midwife, and I am the legislative chair for the Massachusetts affiliate of the American College of Nurse Midwives. I am also the policy director for the Neighborhood Birth Center, which is the group working to open Boston's first free-standing birth center. I also had my own baby with the North Shore Midwives about 3 years ago, and I am trying to figure out where I'm going to go with this next baby. I am here on behalf of my organizations to express a deep concern about the closure of the North Shore Birth Center. This short-sighted decision will mean that there are no birth centers in eastern Massachusetts, which will have major health and economic impacts. Despite the hospital's reassurance that midwifery care will continue to exist at Beverly Hospital, hospital-based midwifery care is not interchangeable with midwife-led birth center care, and that is particular for low-income people and people of color. The 2018 Strong Start study on Medicaid recipients found that birth center care was associated with a 26% reduction in preterm birth, a 20% reduction in low birth weight babies, a 40% reduction in cesarean section, and over $2,000 saved per birth. These are some of the most intransigent issues in obstetrics. They are also some of the areas of the most appalling health disparities for Black, Indigenous, birthing people. The concept that we would close rather than expand and grow evidence-based practice is truly astounding. Secondly, your decision to close the birth center is in direct contradiction to two statewide reports on improving maternal health. Both have been cited tonight, the Health Policy Commission and the Commission on Racial Inequities in Maternal Health. Finally, in the press, the hospital leadership has stated that they would support a freestanding birth center in the North Shore. While I and many people here would firmly believe in freestanding birth centers, this seems naive to the major financial and regulatory hurdles to opening a birth center. The neighborhood birth center has been working for 7 years to raise the necessary funds, secure real estate, create clinical partnerships and safety guidelines. And we're not going to be open in the fall of 2022 when the North Shore closes. If Beverly Hospital and Leahy really believe a freestanding birth center is what the answer is for our community, are they willing to invest in the startup or operating costs of a freestanding birth center? We implore you not only to keep the North Shore Birth Center open, but to value and invest in the midwives and their care. There are countless experts in the state, many of whom are in this room, and there are experts nationally that would be happy to advise Beverly Hospital and DPH on best practices to maximize insurance reimbursement, as well as recruiting and retaining midwifery staff. We must stand up for evidence-based, equitable care for all people and their families. Thank you for your time. I've been asked by one of the organizers, there's apparently a few pregnant people in the audience that might not be able to stay. I don't know if we can go to them to speak, or is that not possible?
It's certainly possible. I just would need to know who they are. So I'm going by the list as people signed up, so forgive me. Just please give me your name. Yeah.
Good evening. My name is Brittany Conant, and Brittany Conant. I have been a patient at the birth center since January of 2020. My family chose the birth center because it very much aligned with my belief in what experience of birth should look like, but also because I've had my fair share of spending time in the hospital as my dad battled cancer for 8 years. The research shows how vitally important it is to be in a positive mindset while laboring, so removing the idea of me having to be a patient in a hospital during the most important day of my life was an easy decision. On August 26, 2020, we welcomed our little girl into the world in the calmness and peace that the birth center creates. It was the most empowering, natural, and beautiful thing I've ever been able to accomplish in my life. When my husband and I became pregnant with our second baby, which is due on September 27th this year, one of my first thoughts was how relieved and excited I would be to have a birth at the birth center again. When I walked into my 20-week appointment, instead of getting to enjoy the sweet moments of sharing the ultrasound results and hearing the heartbeat, I had to discuss with my midwife about the closure that would happen just 19 days before my due date. I had to research for a new care team and find something that offers anything close to what the birth center offers. Let me tell you, I left that appointment in tears because there is next to nothing that mimics the beauty of this center unless I basically want to move to another state or travel over an hour and a half for care. I had one small ounce of hope that at least I would be able to have the care of the midwives that I trusted my family with for over the past 3 years, only to learn that the hospital was not even hiring the midwives to continue their care in the hospital. So now, within 20 weeks, I needed to find new care, build new trust, and give birth in a completely new place. I quickly realized that unless I had about $6,000 to $10,000 laying around to pay a midwife and try to replace the birth center at my home, my chances of this actually being possible were slim to none. I am now being essentially forced into a hospital setting simply because I do not have the privilege or financial ability to do an alternative option. Instead of having a quiet, intimate birth with my trusted midwives and tools like the deep standing tub that supported my birth of my first baby, which I don't think I would have made it if I didn't have that tub. If you've used it, you know. Now I'm going to be with in a hospital setting with people who I don't know, and the amount of people coming in and out all day, with nurses and doctors coming in out of my room that I have never met before, and no guarantee that they will agree with the birth plan that I've created for my family. I'm still holding on to a small strand of hope that the Beverly Hospital Administration will start showing that they care for their patients in the way that they claim in their letter, that they will postpone the closure and allow for the families of the North Shore and beyond to have access to the birth center and the irreplaceable team of the midwives there. Thank you.
Thank you, Ms. Conant. I think now we'll jump to Eugene DeClerk, and then maybe we can move to somebody else who is pregnant. I don't want to hold that. Just trying to mix it up. Please, yeah. Happy to.
Good evening, and thank you to everyone that's here tonight to support Saving the North Shore Birth Center. My name is Corey Kennedy, COREYKENNEDY, and I was fortunate enough to deliver my daughter, Irie, my baby girl, at the North Shore Birth Center in October of 2020. I was fortunate enough that during the scariest year of our lifetime, I had a safe, calm, and peaceful haven to go to for my prenatal care, a place that was separate from the chaos of what was going on at the hospitals during that time. Not only did they provide me with a peace of mind while we all feared the unknown, but most importantly, the North Shore Birth Center assisted me with the safe, natural birth that I always dreamed of, a magical water birth with no medical intervention whatsoever. Fast forward to June of this year, I found out that I was going to be bringing another child into this world. Over the moon and filled with excitement, I called the North Shore Birth Center to schedule my first prenatal appointment. And I was so happy to hear Joanne's warm, kind, and welcoming voice that I remembered so well from my appointments with my daughter. However, the phone call quickly took a turn as I was informed that the North Shore Birth Center was closing on September 8th and that I wouldn't be able to deliver my second child there. As I sat there in tears, waiting for a midwife to call me back to go over my options, I was no longer filled with happiness and excitement. Instead, I was filled with sadness, disappointment, and fear. What I learned when the midwife called me back was that if I want to give birth to my second child in a similar setting to the North Shore Birth Center, my closest option is in Salem, New Hampshire, which is an hour away. With my job, my husband's job, and caring for our daughter, that's just not feasible. So what am I left with? Being forced into a hospital birth, which is absolutely not a substitute for the North Shore Birth Center, and something that I'm not comfortable with. A hospital setting is the furthest thing from calming and peaceful to me, and it's not the environment that I want to deliver my child in. Instead of going into my second pregnancy with a sense of comfort, having already delivered at the North Shore Birth Center and knowing exactly what to expect, I am once again faced with fear of the unknown. Will I be able to deliver my second child without any medical intervention again? Or will I be forced to have an induction once I reach a certain point in my pregnancy? Will the Pitocin cause my contractions to come on too quickly and too strongly that I cannot bear the pain any longer and request an epidural? Will the epidural cause further issues in the delivery of my baby because epidurals come with their own set of risks? Beyond my own personal feelings and fears around hospital birth, statistically, the North Shore Birth Center provides better birth outcomes for women with lower risk pregnancies than delivery at Beverly Beth Israel Lahey Hospital. So why is this safer, more affordable option being taken away from women and putting us and our newborn babies at risk? Why is our choice to take a more natural approach to prenatal labor and delivery care being taken away from us? Is it about profit? Because that's what it feels like. It no longer feels like my prenatal care is about care at all, but more about money. And I think we can all agree that a woman bringing a child into this world should never be about profit. Thank you.
Thank you, Ms. Kennedy. Hi.
Hi, sorry.
No worries.
I had to undress my daughter because it was so hot in here. Hi, my name is Megan, Megan, Everest, Everest, Mancuso, Mancuso. I live in Salisbury. I just wanted to say thank you to all the community members who came out today, to legislators and reps, and a huge thank you to the midwife who birthed
my newest baby, Lily. She is here today, Chelsea. And also my doula, who has helped guide me through both my births, Enza. She's also here today. And all the midwives and Enza helped supported me through my 2 pregnancies, my 6 miscarriages and labor, and all my OBGYN care. That kind of service is what the birth center offers me. I have been going there since 2007 as a freshman at Gordon College. Back then, I valued and recognized what midwives had to offer to my reproductive health. I am a mother of 2 beautiful little girls. I am an Army veteran, and quite frankly, I feel like I had more say in the military than I do right now with my reproductive health. It is very, very disheartening to have to come here tonight and feel like I'm begging, pleading with my case, as well as many others, to keep a medical service, a medical right, and a facility open to Beverly Hospital and Beth Israel that the leadership either does not value or understand what a birth center truly is, because they think it's just about a tub. It's not about the tub. Our opinions matter, and we should be able to determine how and where we give birth. And I've recognized that since being a freshman in college. And I have been going there for OBGYN visits, as well as when I became pregnant in 2017 with my first daughter. I had minor complications, low platelet counts, and they were able to work with that. They were very welcoming, warm, and never made me feel like my many, many, many questions all throughout my pregnancy were ever burdensome. And then in between both my girls, I experienced 6 miscarriages where they provided me the support I needed to help me get through those losses. When I was speaking to the midwife about looking into hormonal imbalances as well as other reasons why I was having these miscarriages, they recommended that I go see a doctor at Essex OBGYN. I scheduled an appointment, and when I arrived, no warning from front desk, no warning from the doctor was in a surgery, and I had to wait 2 hours while having a miscarriage. I, at the time, was experiencing that miscarriage, and when the doctor was finally able to see me 2 hours later from the scheduled time, she was very cold, to the point, with no emotion. It was very hard for me to digest what she was telling me. There was no emotional support that she provided me. She actually went on to say that it was because I was overweight and that I needed to lose weight. That's why I was losing my babies. I have been struggling with my weight because of my stenosis, and she didn't know that. She didn't know my medical history, and she just went right to judgment. A year later, after finally getting over that devastation, I went to a fertility doctor, because if a doctor at Essex OB is not going to help me figure out why I can't get pregnant, who will? And the fertility doctor said it was my thyroid. They could have done that thyroid test right at the hospital, and she shot me down. She didn't do any lab work. She just looked at me and said, "You're probably having a miscarriage because you're overweight." I immediately called the midwives and told them about my experience, and they were immediately appalled that that was the experience that I had from them. I never stepped foot in that facility again, nor will I ever. And when I became pregnant with my second daughter, Lily, I was high risk for a bunch of reasons. I actually had to see maternal fetal medicine.
And they still helped me at the birth center, and I gave birth naturally at the birth center. I had a marginal cord insertion, which means that the placenta could detach at any time. I had low platelet counts because that can happen to me. And I've had 6 miscarriages. So I was on high risk for a lot of different reasons, and I still successfully and healthily gave birth at the birth center. They also understood that because I had so many losses and because I had such a bad experience at Essex OB, they understood the anxiety that I was going through. And they were there for me. When I called multiple times a week, I was asked to be seen weekly, and they accommodated that. Whereas Essex OB, you have a wait list. And the stress on top of stress of trying to figure out when you're gonna be seen is just too much for me to handle, because it was debilitating how much stress I had with this pregnancy, the fear of losing her. And here she is. And the midwives gave me that support I needed.
Megan, can you possibly wrap it up a little bit?
Who's talking to me?
Me. I am.
Oh.
If you can, just move it along.
Okay. Well, I
Forgive me.
have a lot of feelings, and this has been building up, and they need to hear it.
So I apologize. I'm just trying to keep.
I understand.
Yep.
I'm
Thank you.
almost done.
Thank you.
The midwives validated my feelings. If you close the North Shore Birth Center, you close my option to choose how I birth and leave me without trusted OBGYNs of 15 years for me, as I will never trust or step foot in Essex OBGYN. Please do better, Beverly Hospital. Work with us, not against us.
Thank you, Megan. Hi.
My name is Margot Boardney, M-A-R-G-O-T. My last name is B-O-R-D-N-E. And I'm here with my husband, Chris, and our son, Wade. We live in North Reading. We're here today because there is no other care option like the North Shore Birth Center for families in our region. And without it, low-risk people like me will pay more and be less safe in birth. This is because we will have to choose between giving birth in a hospital, where we are more likely to receive unnecessary and costly interventions, or paying out of pocket for a home birth that comes without the safety net of a hospital next door. I chose the North Shore Birth Center midwifery practice for my care because I felt safer giving birth outside of a hospital than in one. Nearly all of my friends had unplanned C-sections. The US C-section rate is over 30%, more than double the WHO recommended rate. My friends, like so many others, had been swept up in the quote-unquote cascade of interventions that leads to low-risk, otherwise healthy people like myself ending up on the operating table. A hospital, by definition, is where sick or injured people go for the diagnosis and treatment of disease. But pregnancy is not a disease. Birth is not an injury. Yet so many hospitals and physicians see it this way. I wanted care that recognized birth as a natural process. I was relieved to find the North Shore Birth Center, where I could access exactly that, the safety of an out-of-hospital birth, free of unnecessary interventions, but right next to a hospital if I needed it, and where I would be cared for by midwives whose philosophy inherently respected the natural birth process. Before I found the North Shore Birth Center, I had considered a home birth and the only other nearby birth center option in New Hampshire, but my insurance wouldn't cover them and we couldn't afford to pay out of pocket. On May 6th at midnight, I went into labor, and in the morning, we drove to Beverly. I was 8 centimeters dilated when I arrived, but we were surprised to find out that I had preeclampsia, even though I had been completely healthy before and during my pregnancy. Under the incredible and compassionate care of my birth center midwife, Liza, I was put on blood pressure medication at Beverly Hospital and was supported in giving birth to my son, Wade, naturally and without other interventions. after I was put on a magnesium drip for 24 hours to reduce my risk of seizure. Without the North Shore Birth Center, I might have chosen a home birth. I would not have had immediate access to the medications that possibly saved my life. Or I might have chosen a hospital-based physician and ended up recovering from the trauma of an unnecessary intervention, like my friends. Experiences like mine exemplify what the research shows and what the experts recommend, that we need to be investing in more places like the North Shore Birth Center, not eliminating them. I urge you to protect this important option for low-risk women like me to access safe, out-of-hospital midwifery care and not allow Beverly Hospital to put profits over the health of women, children, and families. Thank you.
Thank you, Margot. We can move on to you. Yeah. Eugene DeClerk. Our next speaker after Eugene is Pamela Swanson.
My name is Gene DeClerk, Genedeclercq. I'm a professor at the BU School of Public Health and on the faculty of the BU School of Medicine. I'm on the state's Maternal Mortality Review Committee. I think I'm one of the people Kathy was talking about who would be willing to work with others to try to work out a resolution to this, having done research on these issues for 40 years. A couple things I want to note. You cited the fact that one of your criteria is the capacity of others to provide services. I want to address that. You've heard a lot of really passionate and powerful and moving discussions tonight, and I'm not a passionate guy. I'm a numbers guy. I'm a research person. I want to talk about the research on this, and specifically research that we've done over the years, listening to mothers. So in a national survey of mothers, one of the questions we asked was, in the future, for any future births, how open would you be to giving birth at a birth center? 64% of the mothers said they were open to the idea. 25% said they definitely wanted to use it in the future. The striking thing is, these were all women who had just given birth in a hospital. This wasn't random. This were people who had already delivered in a hospital, and a quarter of them said they definitely wanted to use a freestanding birth center in the future. So the question is why? Well, I was involved in a team that did another survey that asked women about mistreatment and abuse during birth. And one of the things we found was overall 17% of women cited some type of mistreatment or abuse during birth. And let me cite some of the factors that they were noting and the distribution between hospital births, women who had hospital births, and those who had birth center births. One of them was healthcare providers, doctors, midwives, others, shouted or scolded you. 13% of the mothers in hospital births said that was the case, 3% in birth center births. Healthcare providers ignored you, refused your request for help, or failed to respond to requests for help in a reasonable amount of time. In the hospital cases, 13%. In the birth center cases, 3%. Your physical privacy was violated, being uncovered or having people in the delivery room without your consent. Hospital births, 10%. Birth center births, 0.6%. So the stories you've heard tonight aren't just random anecdotes. They're manifestations of what's been happening at a national level for years. And this just reaffirms it. I'll leave you with one other pair of numbers. One is 154%. Since 2003, birth center births in the United States have increased 154%. People are voting with their feet. They want this option. Now, to be fair, that's about the same increase as we've seen in home births. Actually, the home births have increased faster, slightly faster, because home births, people can make the choice to do it. There are constraints, but there aren't the kinds of institutional constraints we're talking about here. In Massachusetts, instead of a 154% increase, it's a 54% decrease in the same time. Now, given the numbers that Emily Anesta cited earlier about the distribution of birth centers in the United States, I'm going to close with something I never thought I was going to say, which is, at least in this one case, there is something about Texas we in Massachusetts may want to emulate.
Thank you, Gene. Our next speaker is Pamela Swanson. And then Dana Kerich. Hopefully I said that right.
Before I give my statement, I do want to respectfully request that you do not cut me off. I thought that was very rude to the other person, so please do not cut me off. I have a statement that took a lot of time and mental energy to prepare, and I would like to finish it completely. Thank you.
Sure.
My statement is in response to Beverly Hospital's claim that no negative impact will come to the community with the closing of the North Shore Birth Center. That is a wild claim to make when the nearest birth center in the state of Massachusetts is 128 miles away. Accounting for traffic, a severe lack of public transportation, and today's gas prices, I should be able to end my statement here. But I do want you to hear my story, which is not unlike many others from our community. Throughout my nearly 34 years of life, I've experienced sexual trauma that still physically affects me today, and multiple miscarriages that still mentally affect me today. Since becoming a patient of the North Shore Birth Center in October of 2020, I have never felt forgotten or ignored. I've only had to bring up sexual trauma once. The midwives remained attentive to my emotional well-being during physical examinations, especially internal ones. I have never experienced such precautions at any other gynecological practice, where I instead would have to keep reminding providers until I eventually gave it up. During my last miscarriage, the on-call midwives responded to every one of my many calls that weekend, listening to my fears and cries of pain while coaching me through what I could safely do at home. I never had to go to the ER, never had to put on a hospital gown, and never had to weep in front of strangers. I got through it at home because of the midwives. Afterward, I was routinely checked on and heavily supported. Even now, more than halfway through this pregnancy, the midwives check on my mental health at every visit because they know my history and my current medications. Midwives do more than deliver babies. Midwives provide whole person and gynecological care from puberty through menopause and beyond, an important fact that isn't getting enough attention. Taking away this level of care and support absolutely has a negative impact. I'll be 28 weeks pregnant tomorrow, which is also my first appointment with my new providers. Less than 3 months away from my due date, I am forced to start over. Because of my health insurance, the way healthcare is structured in this state, and the extremely limited access to midwives in our community, I am left with only one option: to deliver at Beverly Hospital. My choice has been taken from me. That has a negative impact, and I am not the only pregnant patient of the North Shore Birth Center. Beverly Hospital has skewed its data to suggest that all recent birth center births have occurred at the hospital and disingenuously claims the closure is related to staffing shortages. The hospital's skewed data and scapegoating of staffing shortages aside, the hospital is ignoring one key fact. In the event that a birth center patient has to deliver at Beverly Hospital due to an emergency situation or what the hospital falsely claims as staffing shortages, a birth center midwife accompanies the patient to the hospital. The midwife knows that patient well, knows their history, their birth plan, their beliefs and fears, and the patient still sees their midwife's warm, familiar face during delivery. Beverly Hospital taking that away has a negative impact. Beverly Hospital claims the North Shore Birth Center isn't needed because it can provide comparable services. So far, the hospital has only suggested it will look into offering tubs for water births. To that I ask, how long will that take? Will I be offered the option of a water birth as I had at the birth center? What about all the other services the birth center provides? Will Beverly Hospital offer whole person and gynecological care from puberty through menopause and beyond? Will Beverly Hospital offer phone support at all hours for patients who can safely be at home or just push them off to the ER? Will Beverly Hospital call to check up on patients who've experienced traumatic events, or will those patients get left behind like so many others before them? The North Shore Birth Center is more than water births and bathtubs, and to suggest that bathtubs are the main difference shows Beverly Hospital's complete disregard for patient satisfaction and quality of care. The birth center provides obstetric and gynecological care from certified nurse midwives in a non-hospital setting. Beverly Hospital is a hospital. It cannot provide comparable services to a birth center. Furthermore, the hospital has confirmed it will not employ any certified nurse midwives and will instead rely on private practices to provide midwives. This means the hospital will have absolutely no control over whether midwives will be present at hospital births in the future. In today's climate of choice being taken away from those with female reproductive parts, the actions of Beverly Hospital putting money and profit over fellow human beings disgust me. My body and my baby's body should not be a way for Beverly Hospital to make money. It might be too late for me to have any choice in how I deliver my rainbow baby, but you, the Massachusetts Department of Public Health, have the authority to not take away that choice from thousands of people in the future. I urge you to not let this closure happen and instead charge Beverly Hospital with exploring solutions to keeping the North Shore Birth Center open. And to Beverly Hospital, I am pleading with you to do better.
Thank you, Ms. Swanson. Our next speaker is Dana Kerich and then Emily Broderick.
Hi, it's, sorry, I'm a little close. Dana, D-A-N-A, and last name is Kench, K-E-N-C-H.
Thank you.
So I am from Swampscott, Massachusetts, and I'm here tonight in support of the the North Shore Birth Center, our community, and to preserve birth choice for my 3 daughters, who were all born with the support of North Shore Birth Center midwives. With the national threats to bodily autonomy, access to reproductive care, and the ongoing fight for human rights, now is the time for Beverly Hospital to invest in our community and the incredible resources of the North Shore Birth Center. It's not time to bring 40 years of exceptional care to an end. I became a women's health patient at the birth center in 2009, not because it was the most convenient provider to my home, but because I knew it to be the best. In 2013, when I became pregnant for the first time, I was grateful to have the midwives by my side. In addition to the caring staff and comfortable atmosphere, what drew me to the birth center was the amount of choice I had in my birthing experience. As the only freestanding birth center situated on a hospital campus, the North Shore Birth Center offered reassurance like nowhere else could. The midwives guided me to make informed decisions, ultimately choosing to try for a birth center birth. At the beginning of Eva's overnight shift, I arrived at the birth center. After laboring for some time, we made the decision to transfer to Beverly Hospital. Eva lovingly wrapped me in blankets as we made our way across the street. The cold air and snowy darkness was beautifully calming. At the 11th hour, it became clear that my daughter's position was not ideal for a vaginal birth, and unfortunately, a C-section was the necessary course of action. After working tirelessly throughout the night, we prepared for surgery exhausted. Disappointed not to be crossing the finish line together, Eva handed the reins to Deb. By our side during surgery, it was Deb who took the first photos of now 8-year-old Regan. Becoming a mother in this specific experience is one of the most influential moments of my life. Without the care, confidence, and knowledge the birth center instilled in me, I don't believe it would have impacted me in the same ways. In 2016, when our second baby was on the way, North Shore Birth Center continued to provide exceptional care. One thing I really appreciated was you'd be scheduled to see all of the midwives throughout your prenatal care, providing little chance that your baby would be caught by a stranger. This is not the case for typical OBGYN care. If your doctor is not on call, it's highly likely you'll have someone you don't know supporting you in one of your most vulnerable times. I had hoped for a VBAC, and the midwives guided me through the risks and possible outcomes. It was due to hospital policy a hospital birth was required. This time, Amanda was my cheerleader. When I felt discouraged and my hopes for a vaginal birth faded, she helped me find the strength within to welcome now 6-year-old Parker. Another 2 years, baby number 3 on the way, more solid in my motherhood, and having one successful VBAC under my belt, a second midwife-supported hospital birth was the plan. I had hoped Lisa could be there to catch her. All the midwives at the birth center are exceptional, but Lisa was special to me. She had been with North Shore Birth Center throughout my time as a patient. She has a calm confidence that I found so inspiring and comforting. Luckily, Lisa was by my side as now 4-year-old Morgan was born. In 2018, 56% of patients who received prenatal care at the North Shore Birth Center and planned a hospital birth after cesarean successfully delivered vaginally, compared to only 9% of patients who received prenatal care elsewhere. I ask, how will Beverly Hospital account for that significant impact? I chose the North Shore Birth Center because it offered more than just women's health, prenatal care, birthing support, and postnatal care. The birthing center is the only place I had choice in my birthing experience would be carefully educated to make the best informed healthcare decisions and have the reassurance of Beverly Hospital right next door. I chose 3 times in active labor to drive to not the closest and most convenient place to have my baby, but to the best choice for us. Anyone who has labored in a moving car or driven a pregnant partner knows that every second and mile matters. North Shore roads are terrible. I am beyond disappointed that Beverly Hospital doesn't see the value that the North Shore Birth Center brings to the greater community and how it is a key part of making Beverly Hospital an amazing family hospital. I hope that my daughters and I can continue to be inspired by the lessons learned from the North Shore Birth Center team as we continue to advocate for our bodily autonomy and rights. I hope that everybody is as committed as Eva, steps up when it counts like Deb, can be encouraging like Amanda, and has a calm confidence like Lisa. I am forever grateful to all the North Shore Birth Center has done for this community and want nothing more for my daughters and others to have access to resources that offer education, support, and choice. Thank you.
Thank you, Ms. Kench. Our next speaker is Emily Broderick, and after Emily is Emily Regan.
I'm Emily Broderick. I'm going to let someone go ahead of me who needs to leave.
Sure. Yeah, thank you.
Hello, my name is Rochelle Garcia, RACHELLE-GARCIA. I am a certified nurse midwife and a women's health nurse practitioner in Massachusetts, and I am the former midwifery director of the North Shore Birth Center. I joined the wonderful team at the Birth Center in March of 2020 and became the director in August of 2020 until my resignation in April of 2022. I am here to speak to the benefits of midwifery services and advocate for continued safe access to out-of-hospital birth center care. Midwives provide care balancing knowledge, experience, evidence-based care, and a patient-centered approach. It has been shown that midwives consistently provide great outcomes for moms and babies at a lower healthcare cost, with an emphasis on autonomy and empowerment, as you've heard here this evening. With Women for a Lifetime is our professional organization's motto. The North Shore Birth Center is no different, providing basic reproductive and preventative health care in addition to prenatal care, labor, and birth out of hospital. Care provided at North Shore Birth Center strongly supports the belief that childbearing is physiologically natural and a sacred right, while also being trained and prepared for emergencies should they arise. The North Shore Birth Center is historic. It is the first birth center in Massachusetts, serving close to 10,000 families during childbirth. There are few comparable and accessible options currently in Massachusetts, which is a barrier to all pregnant individuals and families who are seeking this proven safe and highly demanded birth option. The midwifery model of care at North Shore Birth Center creates a safe, welcoming, home-like environment while promoting self-determination of families, a care model that is not easily replicated, especially in a hospital-based, high-volume, high-risk practice. We are all acutely aware of the recent overturning of Roe v. Wade and how reproductive rights and access are in jeopardy. The birth center closing is no different. Leaving women with less options is reproductive injustice. That's right. In my role as a midwifery director and as a practicing midwife, there were many barriers to providing midwifery care, some of which included more restrictive hospital bylaws than state regulations on nurse midwives, physician supervision of physicians who often did not agree with out-of-hospital birth and early discharge, making birth center birth and early discharge challenging. There was challenging working relations between multidisciplinary staff, who, myself included, were and are fearful of retaliation. There were gaps of time that the birth center went without a midwifery leader. Seemingly, there was little interest to invest or change the care model to better suit patient needs and advancements over the last 42 years, nor to make employment more attractive to support staffing. These are some of the barriers that I feel prohibited our success and were the exact reasons why I unfortunately had to resign from my position. We have families who are seeking birth center care, midwives who can and want to provide the specific care in this type of service. Now we need a safe and accessible place to serve our community. I hope my testimony this evening provides continued support for our community to access equitable and safe options out of hospital. Thank you all for hearing our testimony today, and a very special heartfelt to all of our families and patients advocating here this evening. I feel And there's no words to describe the emotions that we're all going through, but I am deeply sorry for those of you who are here this evening, currently pregnant and having to choose a new option. I deeply wish you all the best, and I firmly believe that no four walls around us can determine the birth outcome that we make for ourselves. Thank you.
Thank you, Ms. Garcia. So our next speaker is Emily Broderick. After Emily is Emily Regan.
Thank you. I'm tall. So I'm Emily Broderick. I am a patient at the North Shore Birth Center, EMILY. Last name is Broderick, BRODERICK. And I actually have the great fortune of reading Dr. Shah's testimony today that Rep. Bellacito mentioned. Hi, I know, we are on an email exchange. My name is Neil Shah, and I am a practicing obstetrician at Beth Israel Deaconess Medical Center, as well as a professor of obstetrics, gynecology, and reproductive biology at Harvard Medical School, who has studied and published peer-reviewed papers and book chapters on the value of birth centers to communities like ours. I am also the chief medical officer of a clinic and understand what it means to bear responsibility for the quality, value, and the finances of a healthcare service. My colleagues will speak to the overwhelming data demonstrating the benefits of midwifery-led birth centers in supporting trustworthy experiences and healthy outcomes, particularly for historically marginalized mothers and babies. What I want to add is that I understand the economic pressures that community hospitals are facing, and why, in a narrow sense, operating a financially viable birth center may seem challenging. I also believe it is a terrible error to view the birth center as a cost center by examining profit and loss at the service line level. North Shore Birth Center is a table stakes investment in the trust, well-being of the community that Beverly Hospital serves. It is not only an investment that the hospital can afford, it is an investment that the hospital cannot afford to overlook. At this moment, healthcare broadly and women's health specifically faces a crisis of trust, and the Beverly community is not immune from this. Fundamentally, the decision to close the birth center restricts access and it restricts choice. The nearest comparable option is 1 hour away in New Hampshire or 2 hours away in Northampton. This creates injustice, and it exacerbates painful inequities of geography, gender, and race. I am thinking of the pregnant woman of color who now has to drive 1 or 2 hours while in labor to access the supportive, empowering, trustworthy care she deserves. This would be unjust, and we cannot allow that to happen. Thank you.
Thanks, Emily. So our next speaker is Emily Regan. Sure.
Good evening. My name is Patrice DeLeon. That's P as in Paul, A-T-R-I-C-E, DeLeon, D-E-L-E-O-N. And I'm speaking on behalf of Megan Tucker. Do you want me to spell her name too?
Sure, yes.
Okay. It's M-E-G-A-N, last name Tucker, T-U-C-K-E-R.
Thank you.
Mm-hmm. I'm speaking on behalf of Megan Tucker, who was unable to be here tonight. She had a medical issue with her son, but she felt that it was important to provide her testimony as to the importance of keeping the North Shore Birth Center not only open, but fully staffed and funded. I have 2 little boys who were born at the North Shore Birth Center. My youngest in the same room. My husband was born back in 1986. Both of my pregnancies started with care at different practices. My first, I moved to the birth center from an OB office after feeling like I was a vessel for my baby. I was often spoken about in front of the providers as if I was not in the room. The change to midwifery care was drastic and incredible. I was finally included in the process, spoken to like a person. I was like the person I was before I became pregnant. I was finally included as a participant in my own care, not as an observer. My son Declan came fast and furious, and because of staffing, I began the process at the hospital with my birth center midwife and was transferred over to the birth center, where he came within the hour. It was truly an empowering experience birthing him in the tub, but it was also quite chaotic. When I became pregnant with my second son, I was worried about experiencing staffing issues again. I began my care at the other practice that delivers at Beverly Hospital. It seemed like a good compromise. I still have midwifery care, but with more consistent staffing. I quickly learned they were nothing like the midwife-run birth center. It was incredibly difficult to schedule my appointments, as I was repeatedly hung up on or put on hold for absurdly long periods of time. My midwife was wonderful, but it felt as though she was constrained in her role at the practice. The final straw came when I had sudden and abnormal pain halfway through my pregnancy. I called and was not taken seriously. I was written off, told it was routine pain in pregnancy, which it wasn't, and I had to beg for an ultrasound. When they finally got me in days later, I was told there were no ultrasound appointments available once I arrived. I broke down in the office, sobbing, before filing a complaint, and I was finally able to receive the care I should have received from the start. I was humiliated, angry, and refused to continue with that level of care. That office is not midwifery care. It is not a valid alternative to the birth center, and it is not a building I will ever step foot in again. In a time where women are screaming to be heard, to be validated, to feel safe at a time we are the most vulnerable, we need more options, not fewer. And Megan says, I am a privileged cis white woman who was not believed. I can only imagine how harder that would be for non-white birthing people who are statistically more likely to experience unfortunate outcomes in pregnancy and postpartum care. I implore you to properly staff and fund the North Shore Birth Center. And those were the words, the powerful testimony of Megan Tucker. But I'd like to add something myself on behalf of me, Patrice. You've heard all of these powerful testimonies of women who don't look like me and how horribly treated they were at your hospital. How can you ensure the safety of birthing people who do look like me, who die at disproportionate rates? I want you to really, really consider this decision. And they were talking about race and equity and all of those things earlier. I also want you to look at the testimony of Serena Williams, the greatest to ever do it in tennis, and how she almost died because her doctors didn't listen to her. Beyonce experienced the same thing. And those people, everybody knows their name. Nobody knows me. How can you ensure my safety and the safety of birthing people who look like me? Thanks.
Thank you, Ms. DeLeon. Our next speaker is Emily Regan.
I have one more line cut because Chelsea caught my baby, so I have to let her go.
Sure. No problem. Yeah.
Hi, I'm
Hi.
Chelsea Perrin, CHELSEA PERRIN. I'm a certified nurse midwife at the North Shore Birth Center, and I've spent 3 proud years providing maternal health services to the women, children, and families of this community at the birth center. As you have already heard, the birth center is a very special place, providing a unique service to the families seeking a more holistic, family-centered approach to the process of bringing their children into this world. Our specialty also includes individualized care for routine women's health exams, contraceptive management, and low-risk problem visits. Our staff take great pride in what we do and have done for this community and for their families. The experience we provide is different than that which can be provided in any typical high caseload hospital-based birthing program, as you have already heard, and it can never be duplicated in that setting, no matter what the claims made here by our administration are tonight. The success and value of our program is evidenced by the turnout of this hearing, thank you guys, as well as the outpouring of support from the families that have grown out of our service. As nurse midwives, our practice is based on relationships, evidence-based care, and a sense of compassion and trust that meets the mother where she and her family are at. People seek out our service, sometimes from over 100 miles away, and once they have experienced it, they come back for their second and third child, as well as for their women's health needs. I myself chose the North Shore Birth Center midwives, who were uniquely also my close colleagues, for my pregnancy and birth care in 2020. Having these amazing providers by my side through one of the most difficult times in healthcare due to the COVID pandemic, as well as during the most altering life experience of pregnancy, birth, and postpartum, meant the world to me. At a time where burnout and compassion fatigue were at an all-time high, the midwives took on a record load of patients seeking alternatives to hospital-only care, all while covering extra shifts for my maternity leave. The sense of loyalty to our program that the midwives and our patients have shown is a credit to Beverly Hospital and Beth Israel Lahey Health, and exemplifies something uniquely and special for our hospital community. That is why the midwives and birth center staff who were so surprised by the plan to close this service, and even more so given how the announcement and plan to close was conducted. We met with hospital management for months over the past year, working in good faith during union negotiations to structure a plan that would allow us to maintain and recruit the excellent and experienced staff needed to run this program. We repeatedly asked in formal negotiation sessions if the hospital had any intention to close the program, and we were assured repeatedly that there was no such plan. We took great comfort when our management agreed to significant wage increases to allow us to retain the qualified staff to continue the service, only to be shocked to learn, just days after ratifying that agreement, that Beth Israel Lahey Health wanted to shut our doors. Worse still, in the process, we all learned that those of us who have given so much to this program will have our positions terminated and we will be fired. I am here tonight on behalf of the staff who have served this community, and more importantly, on behalf of all of the families we have served and hope to serve in the future, to plead with the state to do whatever you can to preserve this essential service. Losing the North Shore Birth Center means losing a reproductive right for women in women's health care. I thank you for hearing my testimony, and I want to thank everybody who has come here to support this service. Vital service, I should say. Thank you.
Thank you, Ms. Perrin. Our next speaker is Emily Regan, and then after Emily is Erica Baker.
My name is Emily Regan, E-M-I-L-E-E, Regan, R-E-G-A-N. I'm a patient of the North Shore Birth Center. I'm 7 months postpartum, and I've yet to receive any notification from Beth Israel Lahey Health that the birth center is closing. Never mind a recommendation for how and where I can continue to receive care. Like thousands of others, my care has not been accounted for in the hospital's description of the birth center's reach and the impact of its closure. I'm a member of the leadership team of the Campaign to Save the North Shore Birth Center. We are a coalition, 1,400 members strong, of parents, grandparents, community members, healthcare providers, and birth advocates. We are standing together to oppose the closure of the North Shore Birth Center and to protect access to the high-quality reproductive care that all North Shore families deserve. We are appalled by the utter disregard that has been shown for patient health and well-being by Beth Israel Lahey Health, and by the dishonest and dismissive behavior of what we have long regarded as our community hospital. We are outraged that medical decisions impacting the bodies of women and birthing people are being dictated and restricted, largely by men. Many members of our coalition are here tonight, and they've shared their stories with the Department of Public Health. It is our hope that you will leave this hearing with a deeper understanding of the devastating impact the closure of the North Shore Birth Center will have on our community's health status. Despite what the hospital has suggested to DPH, Beth Israel Leahy has decided to both close the birth center and eliminate midwife-led care on the Beverly Hospital campus. All evidence, which we have also provided to DPH, shows that this decision will result in poorer health outcomes for moms and babies and will severely restrict access to equitable care in Massachusetts. Despite what the hospital has suggested, Beth Israel Leahy's plans to address these negative impacts are embarrassingly insufficient. By definition, as the senator pointed out of hospital birth cannot be replicated in a hospital. By definition, a physician-led practice cannot provide equivalent care to a midwife-led practice. Sadly, executive leadership at Beth Israel Leahy seems not to understand what a birth center is, nor have they shown any willingness to try or to empower those who do understand to be successful. We are asking the Department of Public Health to listen to women and families when we tell you that there is a difference, and that difference has a well-documented impact on health outcomes. Beth Israel Leahy must be held accountable for eliminating the highest quality reproductive care available in our region, ignoring all evidence-based recommendations for improving maternal health, and for stripping a community hospital of its most beloved service solely for financial gain. The concerns expressed by so many at the time of this organization's merger in 2018, including by the Department of Public Health, are coming to life before our eyes. Thank you.
Thank you, Emily. Our next speaker is Erica Baker, and then Anita Pandolf Richman.
Thank you, and thank you all for being here and staying and listening to all of our testimonies. My name is Erica Baker, E-R-I-C-A, B-A-K-E-R. I am a resident of Lynn, and I continue to be a patient of the North Shore Birth Center since 2018, including 2 pregnancies and unmedicated deliveries with the NSBC midwives. Similar to Councilor Rand and others we've heard, I had 1 birth at the birth center and 1 that took place in the hospital, though both still with the midwives. 4.5 years ago, before the pandemic, I was pregnant with my first child and sought prenatal care with my OBGYN at Mass General Hospital. It is one of the best-ranked hospitals in the country, and continuation of care with an existing provider seemed like a no-brainer. Then, like most first-time parents, my husband and I embarked on a journey of pregnancy classes, one of which took place at Beverly Hospital. And it was during this class, for the first time, I saw videos of women giving birth in a relaxed state of mind, absent the blood-curdling screams of pain we've all come to associate with labor and often sensationalized in movies. It was in that same class all the soon-to-be mothers shared our labor and delivery plans, and it was only then that I first learned of the North Shore Birth Center. As my husband and I began to weigh our options, we realized that the birth center and midwives would give us the best shot at having the natural birth I desired. After all, it combined the best of both worlds between a home birth and a hospital. Expert care and support for an unmedicated birth from the midwives, and the comforts of home with the proximity to a hospital should any complications arise. At 30 weeks pregnant and a month and a half to go before my due date, I transferred my care from nationally ranked MGH to North Shore Birth Center, a facility I had previously never heard of. From the jump, I was informed staffing for the center was spotty, and being able to labor there was not guaranteed. Fortunately, my daughter, like her father, was punctual, arriving not only on her due date, but also during a previously scheduled appointment I had at the birth center. I was successful in the natural unmedicated labor I had wanted only because I had the expertise and support of midwives Ceci and Lisa guiding me to hone in on my body's cues in a calm environment where I could relax into the right state of mind to get me there. Fast forward a couple of years to the middle of the pandemic in December 2020, and I was ready to repeat the experience. Except that 9 days past my due date and in the throes of labor, when my husband called the birth center to let them know we were coming, we learned that staffing issues persisted, presumably because of the ongoing lack of support from Beverly Hospital leadership. The midwives informed us there was a gap in the schedule and I was going to have to deliver at the hospital. I was devastated. Did I mention also in labor? I immediately began to stress about the hospital environment and the possibility of medical professionals nosing their way into my room trying to pressure me into unnecessary interventions. I wasn't far off when in the delivery room during my labor, numerous people were in and out, some not even taking the time to introduce themselves. There's a reason animals seek refuge when in labor, and we are no different. Yet the hospital experience was anything but a calming environment conducive to a natural birth. Fortunately, with the help of the NSBC midwives, I was able to push through my second delivery and bring my son into the world sans intervention. In summary, as a society, we all need to do a better job dispelling the myth of labor being traumatic, reserving hospital space for women who truly need it, and continuing to provide women with access to options like the Beverly Hospital, or the North Shore Birth Center and the midwives there, where they can safely bring babies into the world on their own terms. Thank you all for your time.
Thanks, Ms. Baker. Our next speaker is Anita Pandolf Richman and then Roland Bornhorst.
Good evening, everyone in the audience. When Beverly Hospital opened the North Shore Birth Center in 1980, it was seen by some as a bold move, and it was. The midwives who founded the North Shore Birth Center, Fran Ventry and Joan Richards, brought with them their experience as home birth midwives. They saw their midwifery role as guardians of the normal process of birth. And that's what we've been hearing about tonight. Birth is a normal, natural, healthy, sexual event. I used to say in my childbirth classes at Beverly Hospital, which I taught for nearly 10 years, that how is somebody, if we decided that lovemaking was a medical event, and we'll just check you every 15 minutes, and you won't mind this monitor put on, but the same juices that have to flow for a woman to give birth are the same juices that are flowing when she's creating that life and when the couple is creating that life. So I am here tonight representing those early midwives who founded the birth center. I am here as a guardian of the normal that birth is. And I'll tell you why I have some clout to be able to do that. I'm skipping over things that other people have said so eloquently. I'm speaking here today as a guardian, a woman who gave birth 3 times myself, who has attended hundreds of births in hospitals, at the North Shore Birth Center, at New England Medical Center, at Addison Gilbert Hospital, and at home births, assisted by other midwives. Someone who has practiced as a midwife, birth attendant, RN delivery nurse, postpartum doula, childbirth educator, I swear this really is true, perinatal massage therapist, and now as a holistic psychiatric nurse practitioner. Some people in this room know that I've been saying for years, every woman deserves to have a safe place to give birth and then a safe place to process her birth experience. Too many women have had a childbirth experience where they come out feeling like they were done too. And the hospital staff just sees another vaginal birth and the woman is traumatized. We have heard tonight the powerful testimony of women who were traumatized and who were not traumatized in the environment of the North Shore Birth Center. I have witnessed the ever-surging tide of the medicalization of childbirth. I have fought for the safety and the normalcy of childbirth for over 40 years. I've been a nurse for 44 years and have served in all of those aspects of childbirth. I've witnessed women's perinatal experience being unsupported by this corporate model that we've heard about over and over again tonight, a model that is not what I know as a nurse and a healthcare provider to be health care, but more accurately called health profit. We are here today speaking truth to power, naming a system that puts profit before people. Recently, I had a conversation with an OB-GYN physician at Beverly Hospital, and he said to me, well, midwifery has changed. And I said, perhaps so, but birth has not changed. Of course, this is part of a larger picture where women's reproductive rights are now being challenged and denied. We demand to have decision-making power over our own bodies, whether to be pregnant, have an abortion, give birth at home, in a birth center, or in a hospital. We will not remain silent. And the corporatization of healthcare is a disgrace. Beverly Hospital can do better, should do better, and should also be providing, I heard at the beginning of this, the women's health services. Where are the mental health services? It's deplorable that there are not mental health services for women in particular, for perinatal mental health, as you are so aware of. And so we can do better. This is an opportunity to fill the gaps. Thank you so much.
Thank you, Anita. Our next speaker is Roland Bornhorst, and then Danette Siegel.
Hi, my name is Roland Bornhorst, Rollyn Born. BA. My name is Amanda Alba, and I was a North Shore Birth Center midwife for 6 years. Some of the current midwives fear retaliation if they participate tonight. I am intimately familiar with the challenges that the birth center has faced, and I will speak freely. I thank the Department of Public Health and the press for the chance to be frank about the unnecessary closure of this historic birth center. The North Shore Birth Center is a fixture in the community and continuous operation for over 40 years. The administration of Beverly Hospital has made its decision with full knowledge of how its doors could remain open and what will be lost if they close. I am submitting this testimony to address their justifications for closure. The first claim involves matters of revenue. Birth centers provide a unique service, one that has a growing national market thanks to widespread media coverage of the benefits of midwifery care and the beauty of a home-like birthing environment. The North Shore Birth Center offers this service within feet of a hospital, allowing for safe, smooth transfers if the hospital care becomes necessary. The best of both worlds is the phrase that is often used, but despite glowing reviews from patients, growth stagnated in recent years. This was preventable. In a world where childbearing patients turn to Google nearly immediately after a positive pregnancy test, the hospital relied solely on word of mouth to advertise its gem. Beth Israel Leahy employs a full media and PR team, but the North Shore Birth Center never even had a website, except as a footnote to the main labor and delivery page. Barely something a Google search could capture. Nor did the hospital attempt strategies commonly employed by private practices and other hospital services, like sending mailers to new neighbors or running local magazine ads. The midwives did our best. I even built a website myself and offered it to the administration. It was declined. Another midwife created a video tour of the center that appeared as a small thumbnail on the buried site that was nearly impossible for potential clients to find in the first place. Their second claim is one of unsustained staffing. The midwives of NSBC sought this opportunity specifically, often coming from out of state and relocating their lives and families to be part of the intimate birth center with on-premises support of a fantastic hospital. It is the dream of many midwives to work in a practice like this. But again, as with the marketing for patients, recruitment was never a priority. For reasons I dare not guess, Beverly Hospital HR failed to even post job openings consistently to standard national databases where midwives seek work. When a listing was posted, the descriptions often just solicited a full-time midwife with no mention that this was a historic freestanding birth center. These failures persisted despite our requests and sometimes even pleading. Any offer from us to revise the job description or distribution was declined. We have been told that equivalent care will remain available for patients through a private in-hospital practice if the birth center closes. I was actually concurrently employed by both practices, working shifts with Essex County OBGYN on my days off from the birth center, and there is no real dispute whether or not they are interchangeable. I am confident that the staff at Essex County would confirm this if asked. Midwives at Essex County OBGYN must juggle multiple labors and other acute medical situations simultaneously. Care for uncomplicated patients is primarily managed by nursing staff who, though capable and caring, are complete strangers prior to the day of delivery. An NSBC patient arrives in labor to the same quiet space where she had all her prenatal care, greeted by a familiar face of a midwife that she's come to know. This experience cannot be replicated by a busy hospital practice. Giving birth and being born, these are among our most vulnerable and magical rites of passage. Each birth is the beginning of a new chapter for a family and their community. It is heartbreaking that Beverly Hospital has treated their patients, community, and staff in this way, when they could have chosen to lift up the birth center for the beacon that it is. Since 1980, the sunny little cottage has provided multi-generational health care for women who become mothers and grandmothers there, and for daughters who were born there and then came back to become mothers there themselves. It is not too late to restore our commitment to that mission and to save the North Shore Birth Center. Thank you.
Our next speaker this evening is Danette Siegel and then Kristen Shapiro.
I'm going to let somebody cut in front of me. I'm Danette. And then I'll...
Thank you.
Hi.
My name is Marie Stanek, M-A-R-I-E, Stanek, S-A-N-I-U-K. And I gave birth to my daughter, Cecilia. I had to send her home for bedtime with my husband this past November and received care from the wonderful midwives at the North Shore Birth Center. Early in my pregnancy, I had researched several birth options and had my heart set on a birth center experience in the midwifery model of care. Cecilia is my first child. And while I desired the family-friendly and peaceful environment of a birth center, the assurances of its connection to the hospital helped ease my first-time mom anxieties. And being a local Beverly resident, I felt incredibly lucky to have found such an option less than 15 minutes from where I live. Throughout all of my appointments, I was and continue to be impressed with the continuity of care I received. During my pregnancy, I was able to meet and build a rapport with each of the midwives. I always felt heard and like I had true partners with me throughout my journey to motherhood. My water broke in the early hours on Sunday morning, right when the time changed for daylight savings. And we waited at home until going into the birth center on Monday morning in the hope that my labor would progress enough for me to actually be able to give birth in the center. Unfortunately, and very frustratingly, I was forced to leave the comforts of the birth center in the early evening as it was due to close for the staffing shortage. And we made the decision to actually return home to labor further in the hopes that I could avoid a likely cascade of interventions. I checked into the hospital by late Monday night and labored through Tuesday, receiving pretty much all of the interventions that I had hoped to avoid, before my daughter was finally born at 12:01 a.m. on Wednesday via C-section. We went through a lot of emotional and mental ups and downs throughout my labor, delivery, and postpartum hospital stay, where I can easily say that without the personal care and attention from our midwives and my doula, it would have been much more traumatic for me. I'm incredibly disappointed to hear of Beth Israel Lakey Health's plans to close the birth center, as it had been my hope to also receive ongoing women's health care there. It is also disheartening to be in a position as a mother hoping to grow her family further, especially in one of the most expensive states in the country to have a baby, with very few options and access to out-of-hospital midwifery care. I truly hope that my testimony can attest to the positive impact that such settings can provide, and that access to this model of midwifery care is preserved, or better yet, even expanded. Thank you.
Thank you, Lynn. So next, Danette Siegel, and then Kristen Shapiro.
Good evening, I'm Danette Siegel, D-A-N-E-T-T-E, Siegel, S-I-E-G-E-L. I am from North Andover, Massachusetts. I'm a current patient of the North Shore Birth Center, not as a pregnant woman, but as continued care after 4 pregnancies, 2 successful live births, and 2 miscarriages. I had also one birth at the birth center and 1 birth at the hospital due to staffing shortages, not by choice. Sorry. I am not only a patient, I am a local birth doula, and I'm also an engineer in my day job. After trying to conceive for 9 months, I became pregnant. I had already done all of my research, discovering that birthing at a freestanding birth center with midwives would give me the best chance for an intervention-free and unmedicated birth. I was elated. That is until I began bleeding at 7 weeks. My appointment at North Shore Birth Center wasn't set up until 10 weeks. I called the midwives and was answered with compassion, patience, and understanding. They hadn't even met me in person yet, and they spent hours throughout the course of that day and night on the phone with me, explaining what was happening to me and my baby, giving me options, and letting me know exactly what to expect. They listened to me while I cried from heartbreak and pain, and reassured me that this was a normal process and I would be okay. Fast forward 3 years, after a successful intervention-free and beautiful birth with the midwives in 2019, I found myself pregnant again. This time I was tracking my blood levels and knew pretty quickly, again at 7 to 8 weeks, that this baby was not developing as it should. I called and got right in for a visit, same day, with my midwife, Esther. Women was greeted with the warmest and most reassuring hug you could imagine while I sobbed. She sat with me for over an hour, going over all of my options. She listed the benefits and the risk for each option I had, DNC, medication, waited out. She then put the decision back in my hands and told me it was ultimately up to me and how I wanted to handle it. This is true informed consent. This is true patient empowerment. This is what reproductive care should look like for everyone. We are not all the same and do not fit into a one-size-fits-all care model. Each patient should be informed of all their options and then choose what fits them best, not told what they have to do, like they have no voice or autonomy. Care providers are supposed to be educators, not dictators. This type of care cannot be replicated in a hospital by definition of what a hospital stands for: order, hierarchy, control, money-making. When you let patients know they have options and give them power, well then how can you control them? Birth is natural, wild, unpredictable, and requires surrendering, power, and patience to navigate. Birth is not a business and should not be controlled, rushed, manipulated. It should be allowed to unfold naturally, in time. This is what birthing at the North Shore Birth Center provides clients, an opportunity to let nature take its course. Thank you.
Thank you. Our next speaker this evening is Kristen Shapiro and then Rebecca Haynes.
Hi, my name is Kirsten Shapiro. I know, it's a lifelong struggle. It's Kirstin. Last name is Shapiro. First, I really want to thank both of you. I actually want to thank Tom Sands because I assume you don't have to be here for all of this. And then our elected officials who are standing and sitting here with us. A lot of people have said a lot of amazing things, and I will probably repeat some stuff, but I'll try to chop it down a little bit. I have no harrowing story of induction, drugs, exhaustion, or any other interventions or trauma-inducing experience, and that is the point. I love my OBGYN. She is awesome. I have let her do surgery on me and do procedures on me, but I don't need her to help me do something that is natural and normal and can be done with the care of a midwife without complications in pregnancy. I brought both of my children into this world in a warm tub while meditating, playing music in dim lighting. They came from me to my chest, where they stayed for several hours. Nobody else touched them, except a few fingertips from the midwives. I was repaired by a midwife while my baby lay on my chest. My baby's Apgar was taken while laying on my chest by a midwife. And my husband cut the umbilical cord of my babies, on my chest with the help of a midwife. The air my children were breathing for the first hours of life was mine, and mine was theirs. I cannot quantify the beauty, support, and love of this environment. I knew I wanted midwifery care, and I sought it out even before becoming pregnant. I became a patient of the midwives in 2018. They guided me through struggles with fertility until becoming pregnant. I had heard countless harrowing stories of traumatic hospital births, and I knew if my pregnancies were uncomplicated, I wanted the care outside of the hospital with midwives. Both my birth experience was exactly what I wanted, which is why I sought out the opportunity to give back by volunteering for Beverly Hospital's Maternal Newborn Patient Faculty Advisory Committee. The purpose of the advisory committee was to better serve the community, provide better care, and improve care and experiences for patients of the birth center and the hospital. We would address visiting hours, smoothing out care, postpartum birth visits by nurses in your room, and dining needs of new parents, improving cohesive care from check-in at labor and delivery all the way to discharge. It was no surprise to me that our first meeting involved patients, 4 or 5 of which were all patients of the birth center. There were very few patients, if any, that I can remember that chose to deliver at Beverly Hospital, which speaks to the experience of the women who decided to volunteer their time. Meeting after meeting, myself and other patients urged that the North Shore Birth Center could be marketed more actively to the community. We felt safe, supported in our birth plans, and heard both prior to and while birthing, which created overall outcomes which were closer to our respective birth plans. The tone back from the hospital was generally dismissive, and conversation would be driven back to meal plans and postpartum privacy. This was frustrating because my goal in volunteering was to help publicize and lend support to helping as many people in the community have access and awareness of the North Shore Birth Center and an alternative to intervention and collective trauma of birthing that birthing people are facing both anecdotally and literally when not having access to midwifery-led care. I thought this was part of the purpose of the advisory committee, but it was clear that they were not interested in promoting the use of midwives or the North Shore Birth Center. I believe there is a desire to help enhance the experience of birthing people, but when the patients raised their voices encouraging more midwifery care, it seemed like the hospital didn't want to hear feedback. After several meetings and some emails back and forth, the last email I received about this PFAC meetings was in October of 2021. I wanted to add, since Beth Israel Lahey Health purchased Beverly Hospital, or whatever they did, joined, there has been a systemic sabotage of staffing, marketing, and onboarding to create an untenable environment, which they could blame for the necessity of a closure. Staffing shortages are due to unnecessary onboarding standards beyond that of what the state requires. And also, as many of us know who have been patients, there are several midwives who had children. And I think it's important to note that we should make space for the women who help us raise and bring our families into this world to have time to bring their own families into this world. And that's something that it seems reasonable to request that there be space made for them as well. Thank you very much.
Our next speaker is Rebecca Haynes, and then Mariah, either Monter or Manter.
Good evening. My name is Rebecca Haynes, that's R-E-B-E-C-C-A-H-A-I-N-S, and I am the mother of 3 North Shore Birth Center babies. Like many who have spoken before me this evening, I strongly disagree that the hospital's maternity ward constitutes a reasonable alternative to the essential service the birth center provides, even if they do add a tub or 2 in there. For women like myself, who are fortunate to have lower risk pregnancies, the North Shore Birth Center is the only practice we can choose in the entirety of Eastern Massachusetts that engages in best practices for our specific needs. Because of this, the birth center boasts incredibly low intervention rates, unparalleled in any hospital maternity ward. Birth center-based midwives specialize in the best practices for low-risk pregnancies. They do not rush births along with inductions and other practices that result in a cascade of unnecessary interventions, including C-sections, which are a major surgery that no woman should endure unnecessarily. In 2008, immediately following the birth of my first child, I spearheaded and led the first campaign to save the North Shore Birth Center. At that time, a small group of us met with hospital leadership about their plan to close the birth center. In response to our concern that closing the birth center would result in harm, including more unnecessary C-sections, the hospital's risk manager had the nerve to tell us, very specifically and with a hint of aggression, that if he had his way, every woman who walked through the doors of Beverly Hospital would have a C-section. I am not kidding, and I have witnesses who can attest to this. This, he said, was because he regarded C-sections as more predictable than labor and therefore the lesser legal risk to the hospital. Not a single administrator in the room pushed back or contradicted him, and I ask you all to think about that for a moment. Although that meeting took place nearly 14 years ago, I fear that a bias towards a one-size-fits-all approach to women's healthcare persists in Beverly Hospital's institutional culture, along with accelerating desires in the context of more recent mergers to maximize hospital profits by driving patients to higher cost inpatient services. The underlying issue is not an insurmountable staffing shortage, but rather the hospital's systemic divestment in the birth center, dating back to at least the prior closure attempt in 2008, which is likely an outcome of the gross biases we heard directly from the administration at that time. To this point, I ask you for a couple more minutes as I have been asked to share the testimony of former North Shore Birth Center director and midwife, Reina Dastus. That's R-E-I-N-A-D-A-S-T-O-U-S, CNM MSM, which was emailed in advance of today's hearing. She writes the following. I worked at the North Shore Birth Center as a staff midwife from September 2002 until October 2015. At that time, I became the director and left that position in June 2018 when my family relocated to Western Mass. When I began working as a staff midwife, I enjoyed being able to provide care that I described as the best of both worlds, the experience of an out-of-hospital birth center experience to those who wanted it and met the risk criteria, and midwifery care from a North Shore Birth Center midwife to those who risked out or preferred to be at a hospital. The ability to provide continuity of care to a person who needed to be transferred to the hospital was something unique that I had not experienced at any prior out-of-hospital work I had done. While I was a member of the staff, I gave birth to my own 2 children at the birth center and experienced a miscarriage. Throughout those experiences, I received the same compassionate and supportive care from my colleagues that we provided to our clients every day. My births were beautiful and powerful experiences for me, and I remember feeling so lucky to have the birth experience I wanted. My goals were simple: a healthy baby, and to be able to parent my child. That baby was born at the birth center, and we got to go home from there to recover and begin our journey as a family. About a week after, I realized how lucky I really was to have given birth in a midwifery-led freestanding birth center with a midwife I knew and trusted, who understood the wide range of normal and the skills to know that it was safe to continue with our plan of care in the face of my very slow but steady progress. I cannot say with confidence I would have had the same outcome with the hospital or physician. I'm confident my ultimate goals would have been realized, but the experience would have been very different. This next part of her message, I think, is really key to my testimony that I presented just before. In the 16 years that I worked at the birth center, she writes, I often found myself having conversations with employees of Beverly Hospital who did not know that there was a freestanding birth center on the grounds of the hospital, and employees who did not know what a midwife was. I found this surprising and disconcerting, knowing that the birth center had been in the same location since 1980. How did a hospital employee not know that this was a service offered by Beverly Hospital? How did they not know that there was a practice of midwives employed by the hospital? Why was this not being communicated to all the staff? I still have no answer for those questions. For many years, the midwives asked the hospital administration to assist with marketing the birth center. We proposed creating a website, but we were told it had to be done through the hospital's marketing department. 3 different directors over the years attempted to collaborate with the marketing department to create a web page that was accurate, attractive, user-friendly, and would help clients find the birth center services. Those conversations never got past initial phases and never brought meaningful results. We were limited by the lack of cooperation from marketing, yet we're told that our birth numbers didn't seem to warrant continuing the service. The North Shore Birth Center was founded in 1980 as a place where pregnant people who did not want to give birth in a hospital could go. They've been doing it safely and with compassion, and this mission is just as important today as it was then. In a time when reproductive choices are being challenged and limited, we need to preserve the choice to receive pregnancy and gynecological care at the North Shore Birth Center. End of her testimony. Speaking for myself again, one thing is clear. The problems the North Shore Birth Center has faced are due to a long history of hospitals' management's decision-making to marginalize and undermine its own birth center. To the hospital administration, thank you for being here. I would like to say this. Now is the time to listen to the community you serve. Pause, regroup. We can turn this around together and properly staff the North Shore Birth Center. Doing so is, as you have heard this evening, overwhelmingly in the best interest of the center's diverse patients. And to the DPH representatives, I appreciate the opportunity to speak today and to share Raina's testimony as well. Please declare the birth center an essential service. Thank you.
Please.
Our next speaker is Mariah Manter, and then Katrina Plummer.
Hi, thank you all for being here. My name is Mariah Manter, Mariah Manter. I was born at the North Shore Birth Center 24 years ago, and my brother was born there 30 years ago, and I'm actually sharing my mom's story on her behalf today. Her name is Cheryl Elkins, CHERYLELKINS. Both my children were born here in Beverly at the North Shore Birth Center. In a world with 87 choices for toothpaste and about that many for toilet paper, I was unaware that there were choices for giving birth until my time came to welcome my children into the world. I knew about the hospital and had heard of home births, but neither really hit the mark for me. When I was 16, my mother, Angeline, was diagnosed with metastatic breast cancer. As a family, we spent the next 9 years in and out of hospitals supporting my mother for radiation and chemo appointments, surgeries, and frantic trips when my mother was in pain. In this time, hospitals for me became associated with pain and trauma. When my mother was dying, we had the option of caring for her at home with hospice support. A choice that allowed my mother and her family to have a peaceful experience around her death. Despite the positive experience with the home death, it seemed high risk to me to attempt the other big natural life transition at home. To put it bluntly, if something went wrong with our experience with my mom, she was already in the process of dying. However, if something went wrong with a home birth, the results could be catastrophic. The North Shore Birth Center allowed me and my husband to welcome our children into the world in a relaxed, home-like setting with the safety net of the hospital across the street. This choice helped me to relax and feel like birth was the natural, positive experience it is, rather than an illness to be treated or a traumatic condition to be endured. This choice prevented the inherent fear aroused by a hospital visit from unnecessarily overshadowing the experiences of my children's births. I cannot say enough about the care I received from the midwives. They never left my side from the time I arrived and gave me continual and very specific direction as needed. Their level of care was exemplary, and the birth of both my children was an overwhelmingly real and positive experience, despite very minor complications. What I want you all to understand is the importance of the choice itself that the midwives and birth center gave me. This option was right for me as someone who did not wish to be at a hospital but still wanted a safety net. I'm not present at this meeting today because I'm caring for my 92-year-old father, whose choice is to be at home in hospice care. Having choices as human beings in these big life events matters. I want my daughter and future daughter-in-law to have as much choice as I had. Our society walls us off from the messy beauty of life and death through limited options and one-size-fits-all approaches. This confinement often causes more fear and trauma than need be. A lack of choice strips us of the power to navigate what are some of the most personal and individual aspects of the human experience in the way that is right for each of us. Brushing our teeth and cleaning our bottoms are not the only things in life that deserve options. We also need choices for the big things like where we die and where we give birth. Thank you.
Thank you. Our next speaker is Katrina Plummer and then Brittany Gomes. Katrina? What's Katrina? Is Brittany Gomes. Come on. Thank you.
All right. So I always knew I was going to give birth at the North Shore Birth Center. As anyone who's been there knows, it's an incredibly special place where the midwives care about the mind, body of both the mother and the baby in a wellness-centered model. The loss of this essential service will be devastating not only for birthing people, but for our community. Before I had my first appointment at the birth center, they'd already begun to care for me. I found out I was pregnant in February of 2021, and that day I called the birth center crying with a million questions. One of the midwives called me back within minutes to assuage my concerns and scheduled an appointment and first ultrasound for me sooner than was typical. This was to ensure that everything was okay and that my anxiety would be quelled. From that point on, I felt cared for. Every appointment I had lasted 35 to 40 minutes, and no matter how long my list of questions, no one rushed me out or rolled their eyes. The midwives were the kind of people who applauded my diligence and were willing to answer every single question with incredible detail. I was incredibly lucky to receive such thoughtful care. At my last prenatal appointment, I was actually on my due date, there was a sign on the bulletin board. The birth center would be closed October 12th, 13th, and 14th due to short staffing. I was truly hoping not to go into labor on those dates. As bad luck would have it, I did. I went into labor on October 14th. So despite all my careful planning and preparation for birthing at the birth center, I was going to give birth at Beverly Hospital. One of the most important aspects of the North Shore Birth Center is its connection to Beverly Hospital. I was a low-risk patient, but as it turned out, I would eventually have needed to transfer to the hospital due to meconium and later challenges with delivery of the placenta. This essential benefit of the birth center is part of the reason why it's attractive to pregnant people like me who might not have felt comfortable with a home birth but still would prefer to be cared for by a midwife. The birth center offers the best of both worlds, as we've heard several times today. It's a patient-focused midwife-led care environment with the backup of a medical center and all the trappings of modern medicine in those rare events when it is needed. As it happened, I wasn't given that chance for my birth. Instead of laboring in a comfortable, peaceful setting with one-on-one care from my midwife, my daughter was born in a somewhat sterile room with distractions ranging from beeping monitors, people coming in and out, and a fetal monitor that eventually restricted my movements. My midwife did the best she could, Chelsea, who was here earlier today, but there was really no way to replicate a birth center experience inside the hospital. Charlotte was born a little after 1 a.m. on October 15th, and I will be forever grateful to the amazing midwife, Chelsea, who worked as hard as she did to provide me with an amazing birth experience, despite several challenges. The North Shore Birth Center and its midwives provide patient-centered care that focuses on bodily autonomy and a joint decision-making process. Patients aren't told what to do. They're provided with options and explanations so that the birthing person can make the best choice for themselves and for their families. Should I become pregnant again and the birth center officially closes, I don't know where I will go for comparable care. And there are many other families in the same unfortunate position. As a new parent, this decision feels almost like a slap in the face to myself and the thousands of other parents who have chosen to give birth at the birth center and be cared for by the midwives of the North Shore Birth Center for over 40 years. I forgot to give my name at the beginning, so I apologize for that. Do you want me to do it now?
No, that's fine, Brittany.
All right.
Thank you.
Thank you so much.
Our next speaker is Kit Cox, and then Rebecca Haley Park.
That'll do. I'm speaking for two, but I'll try to keep it down to one person's time. As Kit Cox, I'm speaking also for Linda Ann Labbe.
That's how I was going to say it. Somebody else.
Okay. Linda Ann is Linda hyphen Ann with an E. Labbe is L apostrophe capital A B B E with a little accent. All right, here goes. My name is Kit Cox. I'm here to testify on behalf of the campaign to save the North Shore Birth Center. I'm an early educator with nearly 50 years in the field, and I'm a co-founder and coordinator of North Shore Postpartum Help, a 15-year-old grassroots organization promoting help, hope, and connection that support perinatal mental health in our community. Our work has included everything from creating a theater production based on our members' birth stories to sponsoring the first statewide perinatal mental health day awareness day on Beacon Hill. Postpartum depression is the most common complication of childbirth. Research is clear that mental health of mothers and their partners significantly affects both the short and long-term outcomes of the whole family. In my long-time role as co-founder of North Shore Postpartum Help, I can attest to the critical role that perinatal care at North Shore Birth Center plays in the positive mental health of birthing and pregnant people of the North Shore and their families. The Birth Center is a cornerstone of our community. On behalf of myself and the members of North Shore Postpartum Help, I call on Beverly Hospital, Beth Israel, Lahey Health to halt this closure and to work with our stakeholders to keep the center open. In addition to my perspective, I would like to read the words of a good friend, Linda Ann Labbe, CMN, CNM, MSN, RN, who was present at the opening of the center in 1980 and stayed involved as a nurse, then a midwife, until ultimately becoming the director in 2000. Linda Ann was the director for 15 years, only leaving to take care of her dying mother. She's in Canada today, otherwise she'd be here. Throughout her tenure, she continuously fought to sustain the Center for Families and to improve working conditions for the midwives and staff of North Shore Birth Center. here are her words. Thank you all for this opportunity to address you, especially at a time when women and families are struggling with record high numbers of anxiety, depression, financial struggles, COVID losses, and semi-post-COVID stressors. There has been a door for 42 years opened and welcoming in thousands of women, families, friends, and the next generation of women, families, friends. For many, the North Shore Birth Center is and has been a calming physical space that feeds the body, mind, and spirit. The environment, front desk greeting, and midwifery care are undeniably a benefit to those families that choose the birth center. Time is taken to ensure that women understand what they need to know to care for themselves and their families. Suggesting that this environment of supportive care in the little house close its doors is the reverse of progress. For years, people have fought for women's rights, choices in birth control methods, choices in childbirth, and choices in pregnancy options. These choices must remain available. Regression of these rights and choices is barbaric. The time has come for dialogue, discussion, and creative ideas to be shared between hospital administrators and women's health care providers without judgment or preconceived notions of us and them. We have heard about staffing, wages, hours, births, nurses, doctors, and midwives. The time has come to sit at a table like adults and work at solving the issues, concerns, and injustices we all feel. The North Shore Birth Center put Beverly Hospital on the map for maternal and child health, along with innovative changes. If Beverly Hospital closes the North Shore Birth Center, it will threaten the health and indeed the lives of many of our members of our community. Thank you, Linda Ann. And I'll close with two points. Massachusetts is known for being, and I'm going to give Texas a break here, or not. Massachusetts is known for being a leading innovator in the field of perinatal mental health and health. The regressive proposal we're facing might go over in states such as Florida or perhaps Texas, or perhaps among members of our current Supreme Court in Washington, D.C. But it is totally wrong-headed for our progressive Commonwealth and flies in the face of multiple current recommendations.
Yes.
And a final thought. Perhaps if the 26 Northeast Hospital trustees and corporate officers included more than a handful of females, they might see their way to more policies affirming the rights of women to have choices for their bodies and their birth experiences. Thank you for your time. Thank you.
Just as a reminder, if we can, try and limit your comments to 3 minutes. I know that we're going long now, and we don't have the venue for until 10 o'clock, I believe. So just keep that in mind. We still have actually quite a few people left, so thank you.
Hi, my name is Rebecca Haley-Park, REBECCA-HALEY-PARK. I live in Ipswich, and I'm a former patient of the birth center. When I first heard Beverly Hospital was going to close the North Shore Birth Center, my heart sank. This past winter, I was pregnant with my second child and was elated to be planning another birth at the birth center. I unfortunately lost that pregnancy 2 days before my initial appointment. I am still trying to conceive after that loss, and I am gutted that the birth center may not be an option if and when that happens. The reason the North Shore Birth Center is so special to me is that it was an oasis of holistic, down-to-earth care that was absolutely quenching after nearly 3 years of infertility and IVF. When trying to conceive, my life was, and is, full of blood work, transvaginal ultrasounds, shots in the abdomen, and other invasive procedures. Don't get me wrong, I am extremely thankful for this life-altering care. Without it, my son would not exist. But as anyone who has gone through it can tell you, it is physically exhausting, mentally grueling, and in the age of COVID, when you only see your doctor on a screen, it is easy to feel like you are lined up on a conveyor belt. Life when pregnant, however, was absolute bliss thanks in part to the North Shore Birth Center. To start, the atmosphere of the birth center evokes a friend's home. Not having to enter a traditional doctor's office or hospital during my prenatal care was a welcome relief after so many years of stressful and traumatic medical appointments. Even if Beverly Hospital hired all the midwives from the birth center, they could never replicate this feeling. A hospital will always be a hospital, especially for patients who have experienced medical trauma. And speaking of the midwives, I have never felt more seen or respected by any medical providers. They didn't simply instruct, they encouraged me to make my own decisions by providing appropriate advice, research, and evidence. I was lucky enough to have a water birth at the birth center, which would not have been possible at Beverly Hospital. I did complete a postpartum stay at the hospital since I was a first-time mom. In retrospect, I should have gone straight home from the birth center. The postpartum nurses at Beverly Hospital not only challenged numerous decisions I was making as a new mother, they misgendered and misidentified my wife and told me I was endangering my baby by asking for an early discharge. No one at the hospital even asked for my baby's name until I had been there for over 24 hours. His name is RJ, by the way. I am not saying the North Shore Birth Center is right for everybody. What I am saying is that we need choices. Shutting down the only birth center in Eastern Massachusetts restricts the choices of birthing people in this state. It infringes upon their reproductive rights. It is the opposite of what we need to do in this current political climate. Beverly Hospital, do better. Thanks.
Thank you. Our next speaker is David Hastings, and then Danielle Shea Tan.
Hi, my name is David Hastings, that's D-A-V-I-D and H-A-S-T-I-N-G-S, like the Battle of. There have been 4 formative events in my life, all associated with women. In September of 1975, I married my wife of soon-to-be 47 years. As a result of the years ending in the spring of 1982, the winter of 1985, and the fall of 1989, we together began 3 journeys aided by the midwives of the North Shore Birth Center. Those of you who were around then will remember Fran and Joan and Deb. I don't know how many people can remember their physicians or their nurses that attended to them after 40 years, but these are names I would remember if I was woken up in the middle of the night. These life-altering journeys gave me the opportunity, supported by the magical midwives, to learn and to form my personal viewpoint of fatherhood, of being a spouse paired with another to raise a family together, and to try to emulate the love and compassion shown by the midwives to Linda, my wife, Zoe, my oldest daughter, Alia and Hannah, and me, by understanding and experiencing what these values can do. How love and compassion, paired with scientific and medical training in the strong and supportive hands and hearts of midwives, can assist in the greatest miracle of all, the birth of an infant, the transformative experience of motherhood, of fatherhood, and of becoming a family. Others today have told you of the health and medical advantages of midwives partnering with parents-to-be, and I'll read these fast. Decreased risk of needing a cesarean, reduced rates of labor induction and augmentation, reduced use of regional anesthesia, decreased infant mortality rates, decreased risk of preterm birth, decreased 3rd and 4th degree perineal tears, lower costs for both clients and insurers, increased chances of having a positive start to breastfeeding, increased satisfaction with the quality of care. I'm going to be providing you folks with 6 copies of the Massachusetts Health Policy Commission October 6, 21 report after I testify, which advocates for midwifery and more, not fewer, birth centers. My purpose in being here is to offer living proof that the North Shore Birth Center experience has given me and others as fathers, and now a grandfather, something a hospital-directed birth could never give. I learned by participatory experience, led by my wife and her midwives, in a home-like physical environment, the meaning of being present, being supportive, and love actively assisted by professionalism can provide. Additionally, I live the true meaning of a family-centered birth process. And it's a process. It's not a medical intervention. It is not simply a series of diagnostic codes accounting for the reimbursement for particular consumable supplies, staff time, and administrative overhead. It is a team of highly equipped professionals equipped with knowledge and compassion. It's a physical environment that is not medical, not institutional, and not feeling foreign. They steward you on a journey that helps both parents understand that this journey requires our best efforts in support of each other, beginning with the earliest stages of pregnancy through what will hopefully be the greatest gift prospective parents can provide to continue our species, a healthy infant. Our love for each other grew in nuanced ways that the North Shore Beverly Birth Center helped us discover. The world, our world, needs so much more love and support than it has ever required. I, for one, do not wish to see this source of emotional, life-giving source of love and support disappear, as if all the babies whose names appear in those hearts on the interior walls of the Beverly Birth Center never existed.
Thank you.
Our next speaker is Danielle Shade Tan.
Yes.
And then Lauren, and forgive me on this name, Olson. I'll just stop there.
Oh, yeah. Baby, do you want to go ahead? You're going now?
Please.
Yeah, go now.
Go, Mama.
Hello.
Hello. My name is Karen Galvez, Galvez, Karen. I don't know, Karen. I'm a woman of color on the North Shore, current resident of Marblehead, and a prior resident of Lynn for 7 years. People of color have an increased risk of things like diabetes, hypertension, and heart disease. Women in particular have an increased rate of uterine cancer, postpartum complications, and death. When you become pregnant, it is exciting, but as a person of color, it's also scary because you know the statistics. My first inclination when I became pregnant with my first was to give birth at a hospital with an OB because that felt like the safe option. So at my 12-week appointment, I spoke with an OB of color, someone I deeply researched, to talk about my hopes and goals, and she paused and asked me, have you ever considered a midwife? And I hadn't because I didn't know enough about them, and she assured me of how safe and thoughtful they were. She told me how much they relied on evidence-based practice, and she reminded me that I could always come back if things became complicated, but they never did. So I never went back. And I found that the best thing an OB ever did for me was to refer me to midwives.
Yes.
The North Shore Birth Center is unique in that it has a presence on a hospital campus. It gave me comfort to know that should complications arise, I was just a short walk across the street. This has not been highlighted enough. The closest birth center is in Salem, New Hampshire. In addition to having to cross state lines, my understanding is that the closest hospital to the Salem location is about 15 minutes away. And 15 minutes is a lifetime when it comes to an emergent situation. Beyond pregnancy, the birth center has been vital in providing regular annual services to women across the region. Women who come to the birth center stay at the birth center for everything. It's clear to me that this decision is not based on a lack of support in the community or a lack of data on positive outcomes. It's profit-driven. And the hospital doesn't seem invested in providing the resources to support the center staff. This has been the case for years. We know how long it takes now to onboard a midwife, and it takes time, but it's worth it. I have gotten to know all the midwives at the birth center by name. During my pregnancy, I saw Lisa, Liza, Chelsea, Jess, Catherine, Taylor, and Esther. Rochelle, who also was here, talked me through options when my depression reared its very ugly head in my second trimester. I know them, I trust them, and I love them. I really relied on them for all of my births. I gave birth to